Hello, good morning, good afternoon, good evening. How are you guys? Good morning, good afternoon, good evening, depending on your location. You are welcome. Sorry, I was late this morning. I'm trying to make sure everything is ready to go and then ready to roll for today's program. Good morning, good afternoon, good evening, depending the location where you are watching me from. You are welcome, you are welcome, you are welcome. I thank God today I'm much better. I woke up healthy today. I'm much better. Each day I'm getting better. So once again, thanks to all of you that have been showing concern regarding my illness. But the good news this morning is that I'm much better. Thanks to God. Thanks to Allah for a good health. Yes, today is Sunday. It's very sunny on my side. First weekend of spring. On Friday, we have a blast of snow, and today, Sunday, is a very sunny day, bright. We've made it to spring, so you're going to enjoy the day as it comes. Once again, I welcome you guys. Wherever you are watching me, you are welcome. Please indicate to me where you are watching from once you join the program. It is important that I acknowledge your presence and then encourage you to stick to the program. We shall be discussing an interesting topic today, diabetic foot. What are the effects on feet? I'm going to be backing the discussion today with some illustrations. Credit to certain medical journalists. I'm going to be using their stock pictures to make my point across. This picture is credit to them, okay? I'm using their stock pictures to drive my point across to you guys to understand what diabetic feet is all about. So credit to those stock pictures I'm going to be using today on today's program is credit to the individuals, journalists that made the pictures available to be used free. But you have to give credit to them so that you won't be flagged for copyright. So I'm going to be using those stock images to illustrate my points on diabetic feet. Credit to those journalists that make those images available to be used as long as you credit it to them. So this morning, you are all welcome. Please indicate to me where you are watching from once you join the program. And once again, if my audio is not clear, please kindly send me a comment to adjust my audio. All right. So we can have a program whereby the audio is not clear. You can't even hear what I'm saying. So once my audio is fluctuating or you can hear me properly, please draw my attention by sending me a comment to adjust my audio. Once again, you are all welcome to today's program. We shall be discussing diabetic foot, the effect on feet. We shall be looking how it occurs, the early stages, signs of worsening, the risks if untreated, and then what are the treatment available for your diabetic feet. So these are the things we shall be discussing, and then I shall be also answering your questions as it comes along. You are free to ask your questions at any point in time regarding this particular topic. All right. Any other topic, any other question that is not relating to this particular topic we shall be discussing, I'm going to entertain it at the end of the program. Okay. So, and again, I shall be placing a link. If you want to join the program live, okay, or if you want to ask your question live on video, if you want to join me on video to discuss with me or share your experience living with diabetics, all right, what are your ups and downs? I shall be posting a link on the comment section. All you have to do is click on that link, open it on your browser, download it, and then follow the instruction on how to enter the program. And then once I receive your request, I shall bring you in, and then we shall engage in discussion or ask your questions, and then I'm going to answer it. So once again, you are all welcome to today's program, Living and Managing Diabetics. Okay, this page is all about diabetics and its complications. We discuss anything relating to diabetics, the health conditions, the chronic illnesses, and all the complications that is associated with diabetics, high blood pressure, cholesterol, anything that is related to diabetics, we discuss in these pages. We share ideas, okay, and at the same time, we make a reference that it's important that you see your doctor for a professional advice and treatment. All right, this page is going to give you a guidance and enlightenment and open your eyes the possibility of living a normal life even though you're a diabetic. There are possibilities, things you can do to live a normal life. Okay, so that is the intro about this program. While I'm waiting for everybody to join this program, okay, I shall be pasting a link for those who wants to join the program live. For those who wants to come on live video to join me. I'm pasting a link. All you have to do is open this link in your browser, download it, and then follow the instruction on how to enter the live program, and I'll be notified with your request to bring you in. Okay, so I have posted the link. Follow the link. Okay, that is the link you have to use if you want to come on live. Click on this link. All right, click on that link, open it on your browser, and then follow the instruction on how to join the program live. If you want to share your experience living with diabetics or ask your question live, or if you have any comment regarding this page, follow that link, open it on your phone, on your iPad, or your computer, and follow the instruction on how to enter the program live. Okay, so that is the link. Jane, you are welcome. I appreciate it, Jane. You are welcome. All right. And I have my Salia. You are welcome. All right. Salia from Sierra Leone. You are welcome. Okay. Thanks, you guys. So the link is already there. Once again, this is the link for those who wants to join the program live. If you want to have anything to share to the audience, your experiences, your difficulties in your local area living with diabetics. If you want to have any comment to share your experience with the audience, you can follow that link on your phone and then join the program live. All right. And I'm going to bring you in to have a discussion with you. So that is the link on the comment section. All right. So that is it. I shall be sharing the link as the program goes on for those that are going to be joining later on. So as I was saying, today's topic is we're going to be discussing diabetic foot. Okay, we have diabetic eye, we have diabetic foot, we have all kinds of diabetic complications. All these things arise if you are not managing your sugar level properly. If you want to avoid all these side complications, you have to take treatment of your diabetics very seriously to avoid the complications. It is important you take your treatment very, very seriously. Yesterday, while I was browsing, responding to comment on my page, I come across a video that says diabetic is curable. You have to drink this tablet, just drink this tablet, and it's going to cure the diabetics. From this was, and I was shaking my head. I said, wow, I don't know the length people can go to make money. Just on the Facebook, somebody was advertising a pill, one pill that this diabetics is curable. You drink this pill, as soon as you drink it, it's going to cure the diabetics for all. You don't need to worry anything. And I was just shaking my head, you know, and I went to the page and I see people trying to rush the press. So this guy just want to make the money. You're buying something and somebody's posting a video on the line showing you a tablet that said diabetes is curable, advertising it, and people are rushing it, and I just shake my head. I said, well, I don't know the length people can go to make money. And people are buying it, believing it, and the guy is going to make millions out of it. But at the end of the day, he wants the money. He doesn't care. He's going to ship the drug for you. Whatever you take, that's your own business. The money is in his pocket. And the next thing is going to be on vacation, buying properties, enjoying his life. And he made his millions. All right. And he's a white guy. He's not an African guy. He's a white guy. And I was just shaking my head. I said, the length people can go to say diabetes is curable. You know, when it is known all the world that diabetes is not curable, you can't cure diabetes. It's incurable. That's why they call it chronic. It's like someone telling you that you can cure cancer. There are certain cancers that if you caught it early, yes, you can cure it or send it into remission. But that does not mean totally. It might give you a space for 10, 20 years to live more. The next thing is you come back again unexpectedly, and then you go. I think I told you guys a story about a friend of mine that just passed away. I told you guys a story about it last year. You know, she had a breast cancer, and she caught it early. She went for the operation. They removed the breast, everything. She lived for the next 20 years. You know, everything was okay. She was saying, you don't have anything to worry. 20 good years. She was living life to the fullest. 20 good years. All of a sudden, she went to the hospital. She fell sick, and they find that the cancer come back again. And the bad news that they told her, sorry, there's nothing we can do. That you have only a few weeks to live. Somebody has been living for 20 years. Everything, she went and said, no, everything is gone. You don't need to worry about it. All of a sudden, she was feeling something. She went to the hospital, and they check again because she had a history of cancer. So they want to make sure the thing come back again. And when they go, they say, this is there. And the bad news, they say, you have a few weeks to live. So for the past 20 years, you are living fine. They told you everything is gone. You caught it early. They removed the breast, everything. And 20 years, you live your life normally. And the next thing, you went to the hospital, and they told you that, oh, sorry, the thing came back again. And then she lived for a few weeks and go. So you see, so when they say cancer is curable, people tell you, yeah, you might send it, it's just to buy time. You know, they might say, okay, everything is okay. You are free to go, but you have to keep going on checkup because it can appear all of a sudden again. And when it comes back again, it's going to be deadly. So the same thing with diabetics. That is why you have to keep monitoring diabetics all the time. You got to keep monitoring, even though they say the diabetes is under remission. That you are, or even like, for instance, I give myself an example. My diabetes has gone into remission for a longer period of time. I hardly do, sometimes I take medication, sometimes I don't take because I know what to do. I'm in the profession. So I haven't gone to any test and my sugar level goes up because going to test is just a waste of time because I know that my sugar level is always stable. But that does not mean that I should take my life away from me because it's something that you have to keep monitoring. You have to keep monitoring it to make sure it does not creep in back into your life and start causing damages. Okay, so you have to keep monitoring it. That is why you have to keep monitoring it. Even though they certify you that you don't need to be on medication, everything is okay, you still have to be cautious and keep monitoring and still living as if you have diabetes. Still be doing those things, eat a healthy life, healthy food, do your exercises, reduce your weight. You still have to be cautious at the back of your mind to keep monitoring your sugar level because it can creep in when you are carried away. Oh, you know what, doctor says I'm okay, and then you don't know that your sugar level has spiked up. And the worst thing is that the symptoms are silent. You might have diabetes for 6 months, a year, without even having any symptoms. Except when you are seriously sick, and by the time you get to the hospital, so, oh, sorry, you need a kidney, the sugar level damaged your kidney. And you say, but I was told that they're sent into remission, I was not on medication. Yes, but that does not mean you should not be monitoring your sugar level. It is not curable. Can you send into remission? Yes, you can send into remission, live a normal life, but still you have to be cautious of what you eat and still doing those things to make sure it does not creep in silently back into your life and start causing damages. So when I saw that video yesterday, I was just perplexed and I said, I don't know the length people can go to sell a tablet. It's like for me, I can just come now and start say, you know what, if you take this pill, it's going to cure diabetics, put it $5, you guys are going to rush it. All I need, I just need the money. I make my money. I don't care whatever happens to you guys. And maybe that medicine, most people are going to die of it because they believe the wrong message that this thing is curable when it's not curable. So you guys have to be very careful the things you guys buy online, and then all right. So now let's go into our topic. Let's go into our topic. Morgan, you are welcome. All right, you are welcome. Thank you guys very much for your concern. I still keep getting messages. I'm okay today. I'm much better today. I'm much better today than yesterday. It's gradually the influenza. The influenza knocked me out. It's one thing with me. Okay, I'm going to tell you guys a little before we go into the program. Let me just spend 2 minutes to tell you guys about it. Samantha, you are welcome. I have to see clients. I have to see people coming to see me. Okay, I have a weak immune system. There's one sickness that I have a weak immune system. Flu and cold. That is my weak. If you are, I might be here and you are 1 meter away from me. If you have a flu or cold and just pass. You don't need to come close to me. Just pass. I'll catch it. Just give it 2-3 days. I'll get, and when it comes with real force. It knocks me out. It messes me around. That's the only weakness I have on flu and cold. You don't need to come close to me and sneeze or touch me. Just have a flu or cold. Just pass me. Just pass me 1 meter away. I'll catch it. So when this person comes and I have to attend, I cannot reject. And I see that he has this influenza because we're in a flu and cold period. And I see the person has a cold. I could see the person sneezing. I say, oh my God. Oh, whatever. I can't send the person away. I have to attend. I say, you know what? I'm done. I'm done. I know I'm going to catch it. The person go away. I start cleaning the table, cleaning, sanitizing. It doesn't matter. I've already got it. Because we spent about 30 minutes, almost close to an hour attending to him. And while attending to him, I could see him breathing because it's a virus. You know, while you are breathing, you see the virus is spreading away. And then I say, you know what, forget it, I've gotten it. Because I know my weak immune system. 2 days, I think on Friday, if you guys, there's a video I did with you guys on Friday. I was cleaning my face. I say, you know, why am I sitting? Because I know the symptoms started coming. 2 days, I start having the symptom because I already know that I caught it. And when it comes, it knocks me out. And when it comes, I can't even speak. It will seize my voice. It's going to seize my voice that I can't speak. Okay? I'll be having a running nose, headache, everything, fever, everything. And it's going to last for a week. It must last for a week. So there are two possibilities when you have cold and flu. Okay? We're going to go to the main topic. So when you have cold and flu, there are two possibilities. Anytime you have, and I took a flu injection because you have to take it. Okay, I took a flu injection for this season. There's still, if not because of that flu injection, it would have been serious. So anytime you have cold and flu, there's two ways to treat it. Like in my own case, when I have flu and cold, I don't take any medication for the first 3 days. I don't take any medication for the first 3 days. Sometimes flu will come, allow it. No matter, even if you're taking the medication, it's not going to stop. So allow it for the first 3 days to knock you out. Let it have its way because you are getting the virus away. But at the same time, make sure, because you are losing a lot of fluid, you have to be drinking a lot of fluid back. Because I was sneezing, having a runny nose, I have to be drinking a lot of tea to keep my hydration up. So for the first 3 days, I don't take any medication. I'll allow it to, because it doesn't matter. Even if I start take damage for it, it's still not going to go. So I already know that the first 3 days, it doesn't matter what medication I take, it's not going to stop. It's going to keep coming. So I allow it for the first 3 days to have its way. Then after 3 days, I'll start taking my medication. And then when I start taking my medication and my vitamin C, okay, to build my immune system up, it will start, relieving a little bit. So for the first 3 days, no medication. All I have to do is just allow you to have your way. I'll have a lot of tissue, a lot of tea. I don't expose myself to cold. Don't drink any cold water. You have to be drinking something hot. And don't put any AC. You have to keep your body warm. Allow it to have its way. Okay? For the first 3 days. After 3 days, when all the virus has had its way, I start taking my medication. Then it start relieving it little by little. On the fourth day, it's going to cease my voice. I won't be able to speak. My voice is going to be knocked out. I'll just wait. All I will be doing is take my medication. The fourth day, the fifth day, the sixth day, that is when it starts relieving, and then I'll start getting my voice out. But all you have to do is you have to drink a lot of hot tea to replace the fluid that you are, because you're having a runny nose, you have to replace those fluid back so they don't become dehydrated, and a lot of vitamin C. So, some other people, sometimes I'm not going to take any medication at all. All I have to do was keep drinking my tea and your vitamin C, allow you to go for the full week. On the 5 days, the flu is going to have its way out and then start subsiding. So you can treat it with medication, or you can allow it for the 5 days for the period of time. As it comes, it's going to go away by itself. So that's how I treat it. But the most important thing is that you are losing fluid. Okay, as you are losing fluid, you need to replace those fluid back so you don't become dehydrated. Drink a lot of hot tea. Don't drink any cold water, okay, because you're going to have congestion in your mouth, in your nose. A lot of tea you're going to be drinking and a lot of tissue. And then make sure you wash your hand all the time. If you are living with your family, you have a wife, you have children, make sure you isolate yourself in your room, okay? Let one person to be attending to you, okay? Let one person to be attending to you to bring the, but make sure, even still, they are going to get in contact with it, but make sure you try as much as possible to isolate yourself, okay? Because when I had it, the first thing I did was I isolated myself. For 2 weeks, I was at home, okay, to make sure it is not COVID. I have a COVID vaccination, but I make sure it is not COVID. I still have my sense of smell. But the first thing, if it is COVID, it's going to seize your sense of smell. As long as you're not smelling anything, then you know that, but I'll still have my sense of smell, that I can smell something. So I isolate myself for the whole week to make sure I get myself back. So when you have a family, living with a family, isolate yourself as much as possible and let one person to be attending to you in your room. Okay. And again, if you want to sneeze or cough, do not sneeze in your hand. Use your elbow to sneeze. Okay. That's how you have to do it. So it's very important when you have flu, cold, drink a lot of fluid. Okay. It is important. You drink a lot of fluid because you are losing a lot of fluid. You have to drink a lot of fluid to keep yourself hydrated. Do not expose yourself to cold. Do not put any AC. You have to be warm all the time. And then wait for individuals. There are people that have a strong immune system. Like I have a friend. Also, it doesn't matter whether you come with influenza, he's not going to get it because he has a very strong immune system. Mine, you don't need to come near me. Just stay 1 meter away from me. Have flu and cold. You don't even need to come. Just stay 1 meter and pass. I'll get it. You just cross in front of me. I'll get it straight away. That's it. I've gotten it. So I have a weak immune system in terms of flu and cold. So anybody that has flu and cold, I don't come near them. So when I'm talking to you on the phone, I say, want to come and see me, I'm looking at your voice and the way you breathe. If I sense that you have cold or flu, I say, don't come to my place. Don't come to my office. Stay away. Because I know definitely you are going to give it to me. All right. So thank you guys for those that are showed concern. Let's get back to our topic today, diabetic food. First of all, let me acknowledge those that are coming in now. Samantha, Samrita, you are welcome. Benson, you are welcome. Mbia, you are welcome. Kingsman, you are welcome. I'm drinking tea. Okay. Okay. Mbia, you are welcome. Grace, you are welcome. Yeah, Samantha, yes, I'm at home. So that's why I'm not using masks. I'm at home this Sunday. So I'm alone. If I'm in the public, yes, I use masks, yeah. Mbia Junior, you are welcome. Diane. Diane, we are going to answer that question about your allergies. You said a lot. Let me go to main topic. Okay, Benson, we are going to go to main topic. Greeting from Mauritius. You're welcome. All right. Okay, so Diane, talk about allergies and sinus. We're going to talk about it. Benson said, let's go to the main topic. Okay, so Diane, allergies and sinus. Okay, let me answer that question, and then Benson wants us to go to the main topic. So let me answer that question. Benson, permit me to answer this question about allergies and sinus when you are pre-diabetic. Okay, remember I told you guys, I also have sinus. I'm during the summertime, I have my sinus. I'm allergic to weeds. During the summertime, I don't go near weeds. Pollens, dust. Like in my office, in my home, I don't have carpets. All my furniture are leather. Okay, because the carpet hold dust. I'm allergic to dust. I'm allergic to weeds. I'm allergic to pollen. Okay, and then some insecticides. I'm allergic to them. So those things, I don't go near them. I stay away from them. Okay, like my sinus get worse during the summertime. I wanted to go an operation on my sinuses to remove it, but I don't like it. So I look at the pros and cons, and I decided to leave it. Okay, because I don't like going under the knife all the time. It's only once throughout my lifetime I've been under the knife on surgery. That's when I removed my thyroid. But to remove and do my sinus, they have to operate my nursery and readjust it and get the sinus out. But I said, no, I don't want it. Let me deal with it the way. So, so all those things, I stay away from them. Now, for instance, now on my sinus and allergies, like cold, I told you guys there are medications. I think I showed you guys on one of my videos. There are medications for diabetics to treat your cold and flu. That is what I have. Okay, there are different types. So I use those ones specific for diabetic that does not contain sugar. Is meant for diabetic. That is what I use for my cold and flu throughout for those weeks I am. On my sinuses, as I said, you got to stay away from all those things. As I said, I'm allergic to pollen, dust, weeds, green grass. Anywhere they are cutting green grasses, I don't stay away. I stay away from it. And then you have to change my furniture to be leather. My car have to be a leather seat, not dust, because it contains. If you have a cloth seat, it's going to contain dust. So these are the ways you're going to manage it. And then sometimes I use my nostrils. This is my nostrils, Nasonet. Okay, this is Nasonet. I use it for my sinus during the summertime if I have congestion. Okay, this is it here. They've told me, doctor gave me 2 options to either to remove the sinus permanently, but I have to go under the knife. I decided not to take that option, just to leave it and then manage it by myself. So there are medications for diabetics for those that are having sinuses and allergic. Okay, so so the most important thing is so the most important thing is go for those specific medications that are for diabetic. All right, go for those specific medications that are for diabetic. So that is what I use. That's how I manage it. So you have to go for those specific medications for cold and flu for diabetic. All right, that is what I use. I showed you guys, I did a video about it. There are medications for diabetics if you have sinuses. If you're allergic to certain things, there are medications for diabetics. I showed you guys, I did a video about it. There are different types of it. So that is how I manage it. You can use your nostrils, Nasonet, if you're allergic to sinuses, but you have to identify. First of all, you have to go and see a specialist to identify what are you allergic to. Sinuses have different allergies, components. I have 4 of them. Okay, there are specialists in those areas. You might have only 2 or 1, but it's good for you to go and identify those things that you are allergic that causes you those sinuses and stay away from them. As I said, I went for those tests: dust, green grass, pollens, and some insecticides. I have to stay away. That is how I manage my sinuses, and there are medications specifically for diabetics. All right. So if you go for those things, then you can use it to manage your situation as a pre-diabetic. So let's go to Benson. Wants us to go to specific topic. Azuma, you are welcome. So let's go to our specific topic because Benson says let's go to our specific topic. So we are going to be talking about diabetic food. Okay, we're going to be talking about diabetic food. What are the effects of diabetic food? We'll all be hearing about diabetic food, but why do you have diabetic food? Okay, what do you mean by diabetic food? I'm going to be backing my discussion today with some illustrations. Those are not my pictures. I'm going to give credit. I'm going to mention their name when I'm using those images. They are medical journalists. They provide those images. So I'm going to give credit to them so that I won't be tagged as copyright. So, but you have to give credit to them so they know that you are giving them credit for using their stock images to illustrate your point. So I'm going to be using different types of images while discussing these videos, and at the same time, I'm going to mention their name, give them credit, because they own the rights to those footages, but I have to use it. Now, so we know about diabetic foot. It's a condition of food problems if you do not control your sugar properly. Once we are diabetics, you must at all times. It is a must, it is not a choice, to take it seriously and deal with your situations perfectly. if you are controlling your sugar level as a diabetic right from day one, you are going to avoid those side complications. As I said, the diabetic is not the issue. Diabetic is a whole component. Inside that diabetics, there are things, there are branches offshoot from diabetics. Diabetics is just one word, but there are offshoots from diabetics. Those offshoots, those branches that are emanating from diabetic is what causes you problem. Diabetics is the name. But if you deal with that diabetics, those offshoots running away, coming out from diabetes, you are going to avoid them. And diabetic food, okay, is one of them. And how does it occur? Is if you do not treat or take seriously control your sugar levels. It becomes a food problem linked to diabetics, okay? It's common among people with diabetes, and this problem can occur in one or both foot due to type 1 or type 2 diabetics. All right? Now, the symptom associated with diabetic foot can occur over time. Remember, I said symptoms of diabetes, some of them are silent, some of them are visible. You might be a diabetic for a longer period of time without even noticing, except you are cautious of your health. You are one of those that are very, very cautious of their body and can tell when something is wrong in their body, in their system. Now, they can link to nerve damages or blood flow problem common with diabetics. Now, why do we have neuropathy? Why do we have nerve damages? There are thousands and thousands of nerves, arteries, blood vessels running all over your body and to your feet and to your leg. Now, if there is any, once your sugar level rises above the target range where it's supposed to be and it crosses that target and goes up, okay, it now triggers those burning sensations you are feeling under your feet, those numbness and tingliness. And what does it do? Anytime you're having those problems, nerve damages is occurring because there is an inflammation of those nerves. Some of these nerves cannot be seen with an ordinary eye. You can see only this nerve with a microscope. And once they inflame, once their shape inflame, get bigger, that is when you start experiencing those burning sensations and you are undergoing nerve damages. And that is when they said, when you are experiencing those symptoms, treat the cause of those symptoms to avoid further damages. So since you know that you're having burning sensations, what is the cause of those burning sensations or numbness or tingliness on the feet? It's because your sugar level is high. So now you have to treat the cause of that symptom you are feeling. And how do you treat the cause of that symptoms is by reducing your sugar level back to where it's supposed to be, and these symptoms will disappear. And as I said, there is no cure for neuropathy, diabetic feet. There's no cure. There are thousands of, I can give you lists of medications for diabetic feet, those burning sensation, but it's not going to cure it. It can only give you temporary relief to those pain, but it's going to come back again once your sugar level creeps up. So that is why there is no permanent cure for neuropathy, peripheral neuropathy. There's no permanent cure. Why? It's only one reason. You cannot cure underlying illnesses without curing the cause of that underlying illnesses. When you have a symptom, you have to identify what is the cause of that symptom to start treating it. So how can you cure peripheral neuropathy when you know the symptoms? And this, first of all, you have to identify what is the cause of those symptoms. And we all know what is the cause of when you're having those burning sensations is because your sugar level is high. Now, since we don't have cure for diabetics, how can you have cure for neuropathy? So the only way for us to have a permanent cure for diabetic feet, neuropathy, those nerve damage is to have a cure for diabetes. Because once you cure diabetics, it cures all underlying complications of diabetics. So that is why you can have, I can give you prescriptions of thousands of medication for burning feet, but it's going to be temporary. It's not a cure. Because we don't have cure for diabetics. The only way is, okay, take this tablet. Once your diabetes is cured, all those burning sensations is going to disappear because once you cure diabetics, your sugar is not high, you're not going to have burning sensation on your feet. But once you don't have a cure for diabetes, you're still going to be having these symptoms. Anytime your sugar level creeps up, those symptoms come back. So symptoms associated with diabetes food can occur over time. Just know that in your mind. Diabetic foot problems can affect your skins or the structure of your foot. And that is what we call it foot ulcers. Most foot problems, diabetic foot problems, will have started with foot ulcers. Okay. Now, what are foot ulcers? They are open sores. Okay, foot ulcers are open sores that comes with infections and changes in the people, in the shape of their foot, then can develop. Now, one thing I told you guys about foot ulcers as a diabetic, okay, as a diabetic, let me come watching South Africa. Okay. Now, I said it again, as a diabetic, okay, as a diabetic. Once you are a diabetic or you have somebody, an elderly person that is a diabetic, you must at all times avoid wounds, sores, blisters in your feet or any part of your body. Because right from the one that you have diabetics, you have a weak immune system. Your white blood cells, your self-defense are low. And I've told you guys, once you are a diabetic and you have persistent or constant sugar level high and you have a wound, it's not going to heal. As long as the sugar level is high, that wound is not going to heal. Your healing starts when your sugar level comes back where it's supposed to be, then the healing starts. But while your sugar level is high and then your wounds are open, there's the possibility of an infection through those wounds. And then start developing sores, which are open ulcers, which are foot ulcers, that is going to, if you don't take care, you're going to have those legs amputated. All right. Now, let's let me go to this. Okay. Yes. Okay, this picture I'm sharing here now. Okay. I'm going to give credit to, let me make sure I'm using this to credit to Salzi. Okay, credit to Salzi. I'm using his picture on this program. So I'm using his picture on this program. Salzi, credit to you for providing this picture. Now, look at this picture here. All right. These are diabetic foot syndromes. Okay. These are ulcer on the inner side. Okay. Part of your foot. And these are ulcer on the sole of your foot. All right. But before we go into this, let me hold on. Let me look. There's something I want to show you guys. All right. I'm going to stop this one. This is not the picture I need. Let's use another picture. Okay. All right. Let me use this one. Let me use this one. Okay. All right. This picture is what I'm going to use. You see, look at this picture. This is credit to, let me see who owns this picture. Credit to Smith. Then there's Smith. Credit to Smith. Is this Smith or Primit for using your stock images? All right. Now, if you're diabetics, it's going to start like this. Okay. These are rash, skin rash. Okay. Now, it's going to start in different form. It's going to start in different form. Okay. It's going to start in different form. It can be a small dot. It can be a small dot on top of your feet, on the side, or underneath your foot. That is why if you're a diabetic, okay, if you're a diabetic, make sure you check your foot all the time. Make sure in the morning when you are taking your shower, you are sitting in your living room, and when you are relaxing, check your feet. If you cannot see underneath your feet, put a mirror under your feet. You can see under your feet to make sure there is no blister or sores underneath your feet and underneath your toes. If you cannot see it, put a mirror to see underneath your feet, or ask your daughter or your husband or your girlfriend to check your feet. You must constantly check your feet, and also in between your feet. Also in between your feet, check, feel it. Okay? To make sure there is no open wounds. Because what I say, you have to check. Okay? If you are not controlling your sugar level, for a longer period of time, you might have a completely nerve damage on your feet, and there is no sensation. You can't even have any feeling. Even if I'm using a hammer and knock on your feet, you can't feel it. Because the nerve damages there are completely dead. Blood is not flowing in that area. So you know what? So you might have a wound without even knowing that you have a wound, because you're not feeling it. So that is why you have to constantly check your feet all the time to make sure you don't have something that is not supposed to be on that feet. And if you notice something that is unusual, keep an eye on it to make sure. Like if you have a small dot on top, of your feet, keep an eye to see, because that small dot can be expanding, growing in size. So if you write a date and time, you notice that dot anywhere around your feet, write a date and time and keep an eye on it. If there's any changes in size of that dot in terms of the blister, then go and see your doctor to start immediately to correct it, because it means you are not controlling your sugar level, and it's continuing to now damage your nerves. And now there's no flow of blood in those areas. Blood circulation is hampered because the blood vessels are damaged. So write a date and time. You notice something on your feet that is unusual, and keep an eye to see if it's going to change in size. And when you notice any change in size, then go and see your doctor to start finding out why is that blister in there. So it's going to start something like this. It can start in a different form. All right. So there are a lot of images I'm going to share with you guys as we go along. There are a lot of images I'm going to share. So I'm going to remove this for now, and let's continue. So let's look at why does diabetes cause food problems. Let's look at why you have why diabetes has a food problem. Joining from Lusaka, Patrick, you're welcome. And somebody asked me a question. Doc, is it advisable to stop taking medicine when my sugar level are normal? What I mean is that when taking proper diet below 7 before feeding and below 12 after feeding. Okay, this question is outside what we're discussing now. All right, listen, I'm going to answer this question first because I want us to concentrate on this. Now, I don't want to deviate on this. Stanley says, is it advisable to stop taking medicine when my sugar? Okay, listen, somebody asked me this question yesterday. Normal, what I mean. Okay. You guys see the question. Stanley, I'm going to just take 1 minute to answer this question because I want us to concentrate on this. All right. Now, listen, in terms of, somebody asked me that question last week before I got sick. When it comes to, don't be in a rush to stop your medication. If you're diabetic, never be in a rush to stop your medications. There are different factors that are considered before stopping your medications. And the only person who have authority to stop your medication is your doctor, not you. You cannot determine when to stop your medication. It's your doctor to have to determine if you still need to be on medications or not. Never be in a rush. I particularly am a diabetic in the field. Before I was off medications, okay, first of all, I was given an opportunity to be off medication. I said, no, I want to be on that medication for some time. For you to be completely off your medication as a diabetic, it's going to take 2 years. Right from the day you are diabetic, 2 minimum years. You cannot just say, okay, my sugar level is below 7 for this week, so let me stop medication. No, it does not work that way. For you to be off medication, it's going to take you 2 years right from the day you are diabetic. It takes different factors. You have to do your A1C is what they monitor, not the one you do every time. The A1C, the one you do every 3 months, is what doctors are going to keep. That is what we look at to know how you are progressing in terms of managing your sugar levels. If you keep a clean record for 2 years, for that 3 months, and each time they send you for a test, and your result come back normal, and it's stable for 2 good years without any changes, it doesn't go high, it doesn't go low, you are given a good record every 3 months you went, and doctors see that for two years, that your sugar level is stabilized. It tells the doctor, you are doing a good job, that your diabetes is not in remission, that it is not stabilized. Now, doctor is going to have a discussion with you and ask you, looking at your record, your diabetes is in remission, is stabilized for 2 good years. Now, two things is going to happen. Do you want to still be on that medication, or do you want me to stop it while you manage it with dieting and exercise, living a good lifestyle? It's a discussion you and your doctor is going to have. I have that discussion, and I said, no, doctor, I'm in the field, but I have my own doctor also. I let him, I said, doctor, I want to be on medication for some time because I wasn't sure. And I still maintain a good record. Then he says, you are not supposed to, you are, in fact, I was given a letter that is now in remission. You can now continue to, now you know what to do. Okay? And now, doctor can reduce the medication. It's okay. You know what? You are taking 2 tablets every day. Now I'm going to make it 1 tablet. So it's going to say, okay, let's reduce the number of medication you take every day. So we are going to reduce to 1 tablet. And he's going to monitor that for 6 months to see, since I have now reduced you to 1 tablet, are you still maintaining the same record? So if 6 months on 1 tablet, from 2 to 1 tablet, you are still maintaining the same record, say, okay, you know what? Let's remove the 2nd tablet and monitor you for another 6 months. If the same 6 months again, you stop taking those 2 medications and still your medications are, your results are constant, it's going to say, okay, you know what? You don't need it anymore. Because there's a record to prove that it is in remission, stable for good 2-3 years. And then you are off the medications. And then now by that 3 years, you know what to do. Because you've now become a professional that, okay, I don't need to eat this food. I don't need to do this. I don't need to do that. I need to be exercising. These are the kind of food I need to, because you've now for 3 years, you know what to do without medications. And then you, from there, you keep it up. But you still be monitoring your sugar level to make sure it doesn't silently come back. So it's not like you go for 1 week, 2 weeks, and then you may say, no, okay, no, that's not how it works. You have to maintain good 2 years record for you to go off medications. Now, there's another scenario. If today I got your record and then you were diabetic, and I call you back to my office, I say, look, I received your result, you were diabetic. We're going to have a discussion. And that discussion is going to be, how do you want me to treat you? Do you want to be on medication, or do you want to treat it by, you want to be off medication? That is, you have to now handle it by dieting, exercising, reducing your weight. You know, as I said, there are thousands of people who are not on medication right from day one, and they are living normal life, controlling their sugar level. So if doctor gave you these 2 options, and you say, doctor, I don't want to be on medication, I want to handle it my own way by exercising, eating a balanced diet, that's a different thing. So you, doctor will say, okay, fine. You go, but every 3 months you're going to be coming back, so that he will be monitoring you to see you are not on medication. You say you want to be on exercising and balance. So I will be monitoring you to see if you are controlling your sugar level. And so every 3 months you're going to come back and he's do your test, and he will see, okay, it is working, keep doing whatever you're doing. But if you come back every 3 months and see that your situation is getting worse, that you are not controlling your sugar level, it's going to tell you, look, what you are doing is not working. So now I'm going to put you on medication. So it's going to be medication and exercise. So if right from day one you are not in medications, you continue what you are doing. If right from day one you are on medication, right from day one, doctor have prescribed you medication, You cannot determine when to stop. It's doctor have to determine when to stop. So you have to continue that medication and be doing your regular tests until such a time there's a proven record in front of a doctor to say your diabetes in remission is either will reduce your medication or you don't need it anymore. That is how it works. So you as a diabetic, do not be in a rush to say, I want to stop. It's a lifelong illness until you die. The only way you can be off medication if you help yourself by doing the right thing for 2 good years, then doctor will see a record to say you don't need it anymore. Have I answered your question, Stanley? Because Benson is eager for me to continue this diabetic food. So Stanley, I believe I've answered your question. Talk says loss of sensation. Samarita says, if I have a dead feet, what can I do to increase the blood flow? How often diabetic patient must see their podiatrist? Okay. Now, let's go to Stanley. Have I answered your question? Can you confirm? Now, Talk says loss of sensation. Okay, if you're having loss of sensation in your feet, now Talk from Talk Vete and Samarita, your questions are the same thing, similar. I'm going to answer both of them. If I have a dead feet, what can I do to increase the blood flow? Is the same thing with Talk question. Now, loss of sensation and a dead feet, they're all the same thing. Okay, dead feet could be you're not having any sensation in your feet. Your feet cannot differentiate between cold and hot temperature. Okay, so they're the same thing. What can you do? Now, loss of sensation in your feet. That's why you have to check. If you go to a doctor, they'll test. Doctor is going to use something to hit your nail, hit your ankle to see if you can feel his hand. If you can feel it, it means you are feeling sensation. But when he's touching any part of your feet, you cannot feel it, means there's no sensation. The same thing about dead feet. When your nerves are completely dead, I'm answering Samarita question. All right, I'm answering Samarita question and Talk question. When your nerves on your feet are completely dead, the blood vessels are completely damaged, there will be no blood flow in those areas. There's no blood circulation in that area, or there will be poor circulation of blood in those areas. And once those two things are damaged, you are not going to have any feeling in those areas. Because one, the nerve damages, the sugar level have damaged your nerves. The blood vessels in those areas, arteries have completely damaged. There's no flow of blood in those areas. That is why you're having loss of sensation or there's a dead feet. Okay? That is when you're going to be worried. And once your nerves are completely dead, damaged, there's nothing you can do to recover them back. Once your nerves are dead, damaged, that is it. The only thing you have to do is to save the remaining nerves that are not damaged. So Samarita and Talk, once your nerves in those areas are completely damaged, that you don't have any sensation or dead feet, there's nothing for you to do to recover those dead nerves back. All you have to do is to save the remaining nerves that are not damaged. The same thing like when you don't have erection. A man doesn't have an erection because of you don't control your sugar level, all of a sudden you cannot even have an erection to satisfy your wife, or you have an erection within 2 minutes it's down. Because those nerves have completely damaged. And why you are still having 1 minute erection is because not all the nerves are damaged. So once those nerves are damaged, there's nothing for you to do to repair those nerves to have an erection anymore. The only thing is to save those nerves that make you to have 1 minute erection, because those nerves have not damaged. But if those nerves in those areas are damaged, you cannot have an erection because the nerves and there's no blood circulation in that area. The blood vessels are damaged. That is why you are not having an erection. The only reason why you are having 1 minute erection is because some nerves are still alive. So you have to do is to save those nerves by controlling your sugar level. So any nerve that is damaged cannot be recovered. All you have to do is to save the remaining nerves that are not damaged by doing the normal thing. Now you have to start controlling your sugar levels. So I've answered Samarita questions and Talk. Now, how often diabetic Mbia says, Mohammed, good. Stanley, good. So let's answer Mbia. How often a diabetic patient must see a podiatrist? Okay, I've told you guys like your eye, if you have to see your eye doctor every year. A podiatrist, you have to see them. Okay, for instance, if you're diabetic and you don't have any complication in your feet, you don't need to see them anymore because you are controlling your sugar. The only thing is that you have to avoid those complications right from the start. But once you start having issue with your feet, doctor is going to now send you to a specialist that is specialized in diabetic feet. Okay, depending on the severity of the damages in your feet, you could be seeing those pediatrics every 6 months or every year. So it's when you see your specialist, he's going to see the severity of the length of damages in your feet. If the severity is so intense, then he can even make it every 3 months or every day. But if the severity is less, you can make it so, you know what, it's still okay every 6 months or every year, depending on what the specialist discovered in your feet. The same thing applies in your eye. It depends on the severity of your eyesight problem. You can say you can see him every 2 months or every 6 months or every year, depending how far your eyesight is. So everything on how often you can see your pediatrics depends on the severity of the damages occurring in your feet. So the specialist is going to schedule a time once he has seen you to find out what are the damages, and then he's going to schedule how often he or she can see you. All right, Mbia. So let's get back before Benson sent me to court. Benson, are you still there? I want you to confirm. Benson, are you still there? Now, let's talk about, you see, Benson have disappeared. Benson have disappeared. He's one putting me pressure. Let's go, let's go. Oh, okay. Benson is there. All right. All right. So, because Benson is our police today, he wants us to be on track. So, Benson, if I deviate, bring me back to order. If I spend so many time on one question, let me know to cut it short. So I'm going to give you as my timer. So, all right. Now let's go to, before I continue, for those who wants to join the program live, okay, I'm going to post the link one more. This is the link, okay? If you want to come on live video now to say something, to ask your question or to contribute, follow this link I'm posting now. There's a link I just posted now, okay? That link, okay? Open it on your browser, on your phone, on your iPad, open it, download it, and then follow the instruction. It's going to tell you how to join the program live, and it's going to send me a request that you want to come live, and I'll bring you in, and then we can now have a chat. So anybody who wants to come, all right, so everybody who wants to come on live video now can use that link, okay? Open it now, and follow the instructions on how to join live. So that's the link I just posted now on the comment section, so use that link, all right? All right, okay. So let's go to food clauses. Do they disappear for good, or the same one keep coming back, and what causes them? That is what we are discussing now. Your question is that is what I want to discuss now. Why does diabetes cause food problem is what we are going to discuss now. So your question is what I'm discussing now, Bobo. So yes, they keep going and coming back. Why they keep going is when your sugar level comes back, the healing start. The healing start and then it heals. Once your sugar level keep coming up again, it's come back. Okay, so but that is what we are going to discuss now. So now let's look at why does diabetes cause food problem. Okay, that is what we are going to discuss now. Why does, let me, this is what I'm going to discuss now. So anybody, there's a link there. Anybody that wants to come on live should use that link I posted. Okay, this link on their phone to join. I want somebody to join the program live. I want to see who's going to be brave. Don't be shy. Anybody can join the program live. Don't be shy. Use that link. All right, so this is the topic I'm going to discuss now. Why does diabetes cause food problem is what we are going to discuss now. Why does diabetes cause food problems? All right. Insulin is a hormone produced in the pancreas that controls sugar or glucose, whichever word you want to use, levels in the bloodstreams. In diabetics, either the body can not make insulin, which is in case of type 1, or the body can't respond to insulin properly in type 2. Susan wants to come in. Susan, why did you disappear? Okay. Now, Susan just come in and disappear. All right. So now, insulin is a hormone produced in the pancreas. Inside that pancreas, we have a beta cells. Beta cells in that pancreas is responsible in producing those insulin that your body requires. One, okay, is to produce insulin. Yes, we have the production aspect and the function aspect. So if your body cannot produce, if that beta cells cannot make insulin, which is in the case of type 1, okay, if your body cannot make enough insulin that the body requires to regulate the sugar level, that is type 1. Or your body is producing more than enough insulin, but it cannot use it properly, that's in the case of type 2. Okay, now insufficient amount of that insulin can allow glucose to build up in the blood. Over time, too much of that blood can damage your nerves. Now, I've told you guys what happens when you have excess sugar floating around in your bloodstreams. That time they are floating around, that is when they are causing damages in your nerves and your major organs, your kidney, your liver, high blood pressure, your eyesight. That time they are floating around, that excess sugar is building up and floating around, that is when it's causing that damage. Because how it works is that when your sugar level start building up and floating in your bloodstream, a normal pancreas, your brain is going to send a signal, okay, to pancreas to release insulin to get rid of those excess sugar floating around. Because those sugar floating are supposed to be driven, collected. It's like you mop everything. Say, okay, this excess sugar, follow me, and push them into the cells and liver of your body to be stored. That is what that hormone is supposed to do. While those excess sugar floating around in your bloodstreams, they cannot be classified as fuel until those excess sugar enters the cells of your body and liver and stored. That is when it is classified as fuel that your body needs to give you that energy to farm, to make love to your wife or to your girlfriend or to your husband, to stand, to run, to dance. That is that fuel that you need to do all those things. But as long as that excess sugar is floating in your blood without no direction, that is when it's now causing damages to all the vital organs in your body. All right. Now, which result in peripheral neuropathy? Those burning sensation and numbness or tingling in your feet is what we call peripheral neuropathy. That is the nerve damage in your feet. It can cause you peripheral artery disease, which is the PAD. Somebody asked me about PAD, peripheral artery disease, poor blood circulation. So when you have poor blood circulations in those areas, because the nerve have been completely damaged or the blood vessels have been completely, you have the peripheral artery disease, which is the PAD, affecting the lining of your blood vessels. Okay, so the peripheral neuropathy occurs in about 33 to 50% of people living with diabetics. So the cause of those food problems is because of the excess buildup of sugar in your bloodstream floating around. And that is what causes you to have those food problem. So now the symptoms of peripheral neuropathy include numbness. We only know the symptoms, which include numbness, tingling, and loss of feelings in your foot. As a result, you're likely to realize, you will realize that you have an ulcer, open wound in your feet. I've explained that. Okay. Now, as the wound remains untreated, okay, there's the possibility of an infection that can develop if the wound remains untreated. Okay, now there's the possibility if the wound remains open and untreated, that is how infections penetrate. There's a picture I'm going to share once again to, let me get one picture here. Okay, let's start with this one here. Let's share this one here. So this is your peripheral neuropathy, and this picture is credited to Telfin. Credit to Telfin for using your picture. All right, Brian, you're welcome. Okay, so look at my mouse here. See this mouse here? This is how your healthy nerves look like. Okay, when blood have not damaged your blood vessels, this is how you look like. Okay, you see how look differentiate the two of them. This is a healthy nerve. When your nerves are damaged by by too much glucose. Look at how dark it is. Look at the color of those two of them. Look at the damaged one. Look at the color. This is more darker. And look at the bending. See where it bends? And look at here. You can see differentiate the two of them in terms of the posture, the way it looked like. This one does not bend. You have to follow those arrows there. Okay. This is how your nerves are damaged. It gets, see all how it darkens. This is how it darkens. You can see it here because here there's a flow of blood. There's no any nerves or blood vessels that are not damaged. But because the nerves and the blood are damaged, you can see that the bloods are not flowing properly, so they get stuck on the linings of the blood vessels. Okay, so this is how the nerves unhealthy now look like, and this is the healthy one look like. All right, this is peripheral neuropathy. Now I'm going to remove this picture. I'm going to show you guys one more here, and then we'll continue. Let me see what is going on here. Okay, let me go on this one. Let me go on this one. Let me go on this one. All right, this is ulcer. Okay. Now on this picture, I'm going to share. Okay. You know, I told you guys that if you cannot see underneath your feet, put a mirror on the floor and put your feet on top of that mirror for you to see under. Or if you have a child, a son or a husband, let them inspect your feet. If you have an elderly, a parent, check their feet all the time. Now, this is how foot ulcer started. And also check in between. Feel it. Put your finger there to make sure it's smooth. Don't just look at it. Put your finger in their feet. Make sure there's nothing rough in between. Okay? Because looking at it can be deceiving. Put your finger in between your feet, your toes, and feel it. Now, this is how foot ulcer start, or sores, or wound. This is your skin. Okay, this is your skin. Now, I want to show you guys tell you guys something. You know, sometimes I told you guys, if you don't treat your wound and you allow the infection to penetrate, it can develop an infection that can lead to an amputation. Do you know how amputation starts? When Mohammed, I'm going to answer your question. Let me finish making this point. When you have wound, like as you are seeing in this picture, this is your skin. Let me use this as a skin, as my leg. You have wound here. There are different layers before it touches your bone. Okay? That's why you see somebody have a wound. Once that wound is on top here, look at here, where my arrow is, they are treating it. That is why somebody will have a wound for 1, 2, 3 years. But as soon as maybe 6 months, 1 year, the next 2 years, they're still amputating. Because that infection is not spreading. Infection cannot spread from the top of the skin here. You see all these things here? It cannot spread. That is why that wound is going to be going down until it touches the nerve and the bone. Once it touches the nerve and the bone, infection spread through the bones fast. So when you are treating the wound, because your sugar level is still high and you are not controlling it, it starts penetrating down. As it's on top, you are okay. It's going down to touch the bone. As soon as it touches the bone, bam, that is when it spread. That is when doctors say, no, we are going to amputate to save your life. Because the more you allow it, the more it keeps spreading, and then it's going to reach your heart and kill you. So as soon as you get in contact to your bone, straight away, amputation, they will look at that area, the spread of that infection, where it touches. They can see it as, okay, the infection has started from here, it has spread all the way here. So it means we are going to cut your foot from here to save this part that has not been touched. Okay? So you can see from that picture I'm showing you on the screen there, it is going down from the ulcer. See, from this ulcer, it is penetrating, going through different layers until, that is why they are actually control your sugar level to save it that time, to heal it, let it stop here before it touches your nerves and blood vessels and bone. So you have to make sure, against all, or to make sure you stop it here, not to go further down. As long as it is here, it cannot spread. Okay, so doctor will say, please control your sugar level so that the healing will start. As long as your sugar level is high, it's not going to start. An infection will penetrate. Once infection penetrates, it is going down. It is aiming to the bone, where the nerves and the blood vessel is touching, connected. And once it reaches that bam, that's when you have the bad news. We have to amputate. Because now once it touches the bone, it spread like a wildfire fast. And they are going to find out how far it has spread and then cut it from that area to save the other life. So that is why you have to, as soon as you notice any wound, no matter how small it is, write the date and time. You notice that difference. If you see it spreading, go and see your doctor immediately. But you yourself know why it is spreading from small dot to bigger is you are not controlling your sugar level. That is why you are giving it oxygen to start expanding. And once it's expanding, it is going down. Because once it's expanding, you don't allow an infection to penetrate. Because once infection penetrates, bam, it is aiming to the bone to spread like a wildfire. And that is when they say we have to amputate. So anytime you see a small blister or wound on the top of your skin, write the date and time and keep an eye on it. If you see it changing in size, go and see your doctor immediately to start taking notice and then start treating it before it gets to your bone. All right. So that is that picture I want to show you guys here. Credit to who owns this picture. I'm trying to see that name. Credit. This picture does not belong to me. It does not belong to the page. I'm using it from credit to, I think, I can't see the name properly here, but whoever that got that picture, we are giving you credit to this picture to use it. All right. Brian, you're welcome. So that is it. So I'm going to remove this picture. I have more pictures as we go down. I have more pictures to show you guys. Okay. Let me answer Dr. Mohammed questions. A doctor prescribed Tadalafil for erectile dysfunction, but it couldn't help. Is there any medication I can try? There are different medications for erectile dysfunctions. You can use Viagra or Cialis. The popular one is Viagra or Cialis. Okay, Samantha, thank you very much. Okay, so Viagra or Cialis. Okay. Somebody asked me, Mohammed, that's the one I just posted there now. You can use Viagra or Cialis if that is not working. But make sure before you have use this medication, see your doctor, because Viagra is very strong. Viagra is very strong for your heart rate. It has to correspond with your heart rate. And Cialis. So why doctor did not prescribe you Viagra or Cialis, depending on your age and your heart rate. So before you start using it, make sure you consult your doctor if you can use Viagra or Cialis, because Viagra is a strong tablet. Okay, you have to make sure you consult your doctor before using Viagra or Cialis. They have to determine your age and your heart rate, because there are some men in their 60s, 70s, and they use Viagra and they have an erection that cannot, even after the erection cannot come down. Okay, they use it. You could see a 70-year-old man that used a Viagra. The thing cannot still come down, and it was a problem for him. Because of the age, the heart rate, he can't keep up. So you have to make sure why doctor did not prescribe you this. There are a lot of things they have to put into consideration: your age and your heart rate. So they don't go and take Viagra after finishing and the thing is still standing up, and you become a problem for you and you start shouting and looking for help. So make sure you see your doctor before you use Viagra. Okay. So now let's go to there are more pictures to share. Okay, in terms of this, let's continue our topic. Now, as the wound remains untreated, okay, an infection can develop. An infection can develop. All right. However, blood vessels damaged by diabetes can interfere with normal blood flow. That is the PAD. Okay, which could help heal the wound. Okay, an untreated infection and poor blood circulations can lead to major heart problem called gangrene. You guys have heard about gangrene? Gangrene is when all things have been done to heal that wound and it's not healing. And then it now penetrated to the bone and is spreading. At that stage of gangrene, you are looking for one option out to save your life is amputation. Okay, you know, gangrene can lead to the death of the skin, death of the muscle, and other tissues in your body, and possibility of an amputation as the final options to salvage the problem and save your life. We call it, you know, gangrene. All right. Now, the next thing we are going to talk now, there are stages. There are stages. Okay. There are stages we are going to look at now. This is what we're going to discuss now. We're going to discuss this. What are the early stages of diabetic foot? This is what we're going to discuss now. What are the early stages of diabetic foot? I'm going to remove this picture now, and then let me see. Let me see if I have it here. 1, 2. Okay. All right, what are the early stages of diabetic foot? We're going to look at the early stages. Somebody asked me a question now. We're going to look at the early stages of diabetic foot. Somebody asked me a question. Somebody asked, I'm trying to figure that question. I'm looking at, well, somebody asked me a question. Where is that question here? I know I saw a question. Somebody asked me a question. Okay, all right, I've seen it here. Somebody asked me a question before. Okay, Benson, permit me to answer this question, okay? Because we have somebody monitoring our time. So Benson, permit me to answer this question. So what causes varicose vein? Okay, why I'm answering this question is relating to our topic. What causes varicular veins? Okay, varicular veins is as a result whenever the blood pressure increases inside your vein. Okay, a varicose vein may form, okay, when the blood pressure increases inside your vein. This can happen, okay, because of your age, your pregnancy, if you are pregnant in terms of a woman, overweight, and obesity. There's difference between overweight and obese. They're two different things. Okay, varicose veins may form in you whenever blood pressure increases inside your vein, and this may be due to age, pregnancy, overweight, or obese. So for instance, if you are sitting for too long or standing for a long time period or inactivity lifestyles, you risk being having a varicose vein. That's why you have to exercise. Like, you know, sometimes when you sit down, like for instance, you are flying a flight. Like the time I traveled to New Zealand. It's about 20-something hours flight. So you can imagine sitting on a flight, on a seat for 21-something hours. Sometimes I have to get up from my seat to go at the back of the plane and walk around, exercise, just to release, because you're the human sitting in a plane for 21 hours to avoid this problem. So sometimes you see people getting up from their seats, they walk around. You're allowed just to walk around to exercise your feet. You don't want to sit too long. You don't want to stand too long. So it's formed when the blood pressure increases inside your vein. It can happen due to age, pregnancy, overweight, or obese. Okay, due to sitting or standing for a longer period of time, or you are not the person that is active. You are not the type that want to exercise. So if you don't do all those things, you are in a higher risk of having this varicose vein, or you have a family history in your life. So these are that is sorry, what did I do here? Okay, I'm trying to all right. Okay. You see, look at the question. Okay, Bobo, you see the question here? Look at it here. I'm going to make it enlarge a little bit. Okay, see your vein. You see what here? I'm using this picture created to Cleveland Clinic. All right. So look at the normal valve. Okay. You see how your varicose vein is here. You see the normal blood flow. You see how the blood flow here. The normal valve, the normal vein. Okay. Now see abnormal blood flow because of maybe you are sitting or standing for too long. You see you see how everything is squeezed. Blood is not flowing properly because of damaged valve, abnormal blood flow, or varicose vein. See how it look like? You see how it's squeezed because you have been sitting for too long, standing for too long, or due to age, or you are obese. Okay, you see how it look like in your legs here? See how it look like? So this is the what it is. So if you have been, it could be due to your age, if you're a woman, pregnancy, overweight, or obese. But these are the difference. Okay, so when you have been standing for too long or sitting for too long, or you are not the type that exercise, you might develop this vein because blood is not circulating properly due to squeezed vein. See the difference here? That is the cause. Okay, that is the cause. Okay, I'm deviating a little bit. So I think so this explain the difference. So I'm going to remove the picture and let's get back to our topic. All right. So I'm going to remove this picture now. All right. So let's get back to what we are discussing. Vicky. Okay. So this is the stage. We are discussing the early stages of diabetic foot. Let's discuss the early stage. Okay. Let's discuss the early stage. Okay. I'm posting the link again. Those who wants to join the program live can use this link. To come on live video and join. For those who wants to join now, can use that link and join. All right. So download it on your phone, open it, and follow the instruction on how to join. Okay. If you want to come on live video now, you follow that link, use that link, and then join. Okay. So Now let's go back to what I want to discuss here. Where's the topic here? So, early stages of diabetic foot is what we are going to discuss now. So, there are different stages of diabetic foot. Okay, there are early stages of diabetic foot problem often go unnoticed. Okay, I've said this since they are not specific to diabetic foot. So these early stages are not specific to diabetic foot. So you have to learn how to identify these changes, and that will help you to prevent serious complications. Remember, they are not specific only to somebody that is diabetic. So you have to learn how to identify these changes in your feet to prevent serious complications. So once you notice it, it is important you visit your healthcare provider, your doctor, your family doctor, your physician to get you treatment immediately. It is important. Once you notice any differences in and around your feet that is abnormal, make sure you see your healthcare provider. Now, what are the early stages? Number one, pain or cramps in your leg. I want you guys to write it down. Write it down. I'm going to be slow. Okay? I'm going to be slow. So for those who wants to, write it down. One is pain or cramps in your legs, calves, thighs, or buttocks, especially during physical activities. We're discussing the early stages of diabetic foot. Okay? Number one is okay, I posted it in here now on the comment section. Number one is pain or cramp in your leg, calves, thighs, buttocks, especially during physical activities. I'm discussing the early stages of diabetic foot. That is number one. Okay. Number two. Number two. Number two is numbness. Okay, numbness, loss of sensation or the ability to feel heat or cold in your feet. We are discussing the early stages of diabetic foot. That is number two. Numbness, that is loss of sensation or the ability to feel heat or cold in your feet. Let's go to number three. Okay, number three. Number three is burning, tingling, or pain in around your feet. Number three is burning, okay, you have this. Okay, so that's number three. Let's go to number four. Number four. Okay. Number four is dry, cracked skin on your feet. Remember, these are the you see the way I make it from number one to number four is the sequence, how it occurs, how you start getting diabetic feet. Number four, the way I'm describing it is the sequence, how you start having diabetic feet from number one to the last point. So number four is dry, cracked skin on your feet. Remember, I said early stages of diabetic foot. So the way I'm listing them from number 1 to number 10 or number 20 is the way it occurs. So you have to know, if you're having this issue, you have to know at which stage you are now. That is number 4. Okay, welcome. Always a late comer. I know you go to church. So number 4. Let's go to number 5. Number 5. Okay. Number 5 is this: loss of hair on your feet, toes, and lower legs. That's number 5. Okay. Let's go to number 6. Rejoice, you're welcome. Latecomer, always a latecomer. Maps, always a latecomer. Oh, we have our latecomers. They are coming now. So that's number 5. Number 6. Number 6. Number 6 is this: athletic foot, that is Diabetic or other fungal infection between your toes. When you have fungal infection, remember I told you guys to be checking your toes in between. Feel it. Put your hand here and feel it. Feel it. If you have any fungal infection in your toes. We are discussing early stages of diabetic feet. That is what we are discussing now. Early stages of diabetic feet. So number 6 is when you have athletic foot or fungal infections in between your toes. When you are checking your feet, always put your hand in between your toes to feel if there's any sore. Do not just look. Look with deceiving. Okay, let's go to number 7. Okay, let's go to number 7. Number 7 is this: thickened yellow toenails. That's number 7. And then let's go to number 8. Number 8 is a sore, blister, ulcer, infected corn, or in the ingrown toenail. This is number 8. Nat, you are welcome from Belgium. Wow, first time to see somebody from Belgium. You are welcome. Welcome to the family. All right, welcome to the family. So number 8 is a sore, blister, ulcer, infection, corn, or ingrown toenails. We are discussing early stages of diabetic foot. Okay, so that is number 8. Can you give a shout out? Welcome Nat from Belgium. First time somebody from Belgium. Could you guys welcome Nat from Belgium? Somebody should give them shout out. I want you guys to welcome Nat from Belgium, watching from YouTube. So number 8 is a sore, blister, ulcer, infected corn, or ingrown toenail. All right. So we're discussing the early stages of diabetic foot. Okay. Remember from number 1, that is the sequence. When you start having diabetic foot, you start from number 1. That's what we call it, early stages of diabetic foot. You start from number 1 and then keep progressing, keep progressing, keep progressing. All right. Okay, good. Good. All right. So it starts from number 1 and keep progressing. Remember, diabetes is a progressive chronic illnesses. It started mildly, from mildly, and it keep progressing if you are not controlling your sugar level. So we are discussing. Okay, thank you guys. So that is number 8. Then let's go to number 9. This is when it becomes serious now. This is when it becomes serious. You are having this. you are having edema, swelling. Okay, you start having swelling in your feet. All right, you start having swelling. That is number 9. Let's go to number 10. And why do you have swelling in your feet? Can someone tell me why you have swelling in your feet? Now you're having PAD, okay, because there is no you're having a poor blood circulation in those areas. The nerves, the blood vessels are damaged, and now things are not circulating properly. You start having PAD, okay, peripheral artery disease. Now we'll go to number 9. We'll go to number 10. We'll go to number 10, which is redness or warmth on the feet. Redness or warmth on the feet. That is when I showed you guys this picture. Let me go back to this picture again. I shared that picture early. Let me see if I can go back to that picture again. Yeah, I shared this picture. I shared this picture earlier. Okay, you start having redness or warmth on the feet. Okay, you start seeing these symptoms physically now. All right, you start seeing redness on the feet. Now let's go to number 11. This is number 11, which is the final stage. Okay, changes in the shape of your feet, possibly heading to a rocker bottom, which is a sign of rare form of diabetic foot called, Charcot foot neuropathy, in which the bones in your feet and toes shift or break. So the way I listed it is the sequence, the early stages of diabetic foot. All right. Now I'm going to remove this picture. There's another picture. Let's remove this picture. I'm going to remove this now. Let's look at this picture on the stages. Let me see this picture. This. Okay. This is the stages. So, no, this is not what I want to use. Let me find a better picture to use. Let me find a better picture to use. Yeah, let me use this one. Yeah, okay, this is the picture I want to use, which is more clearer. These are the stages. Okay, this one is this is 1, 0 here. This is 0. The first one here is where my mouse is pointing is 0. Okay, this is the 0. This is stage 1. The second one is stage 1. Okay, this is stage 1 here. The stage 1, the 0 here, where I'm pointing now is 0. It says normal fit. This is no. Let me see what this. First of all, let me give credit to Greeny. The owner of this picture is Greeny. Greeny, I'm using your image. So credit to Greeny. Okay. Thanks for providing this picture to use in this program. So credit to Greeny for using this picture. Now on 0, this one I'm pointing here. Okay. This stage 0. Okay. It says no delete. Okay, no delete. Number 2 here say number 1, stage 1, where I'm pointing now is stage 1. It says superficial ulcer. Superficial ulcer. Okay, this is the beginning. Superficial ulcer. They go to stage 2. It says deep ulcer. Stage 2 here I'm pointing says deep ulcer. All right. This is stage 2 where I'm pointing. It said deep ulcer. Now let's go to stage 3. Stage 3 says osteitis. This is called osteitis. Okay, this is osteitis, stage 3. And then stage 4 says partial gangrene of the feet. This is because it's not getting deeper into the bone, into the nerves. It's a partial gangrene. You could see the coloration. It starts changing because there's no blood circulation in those areas. So blood is not reaching. So the skin is not changing. The shape of the feet is not changing because it is a dead feet. So this is a partial gangrene of the foot. And then the last stage, stage 5, is gangrene of the whole foot. This is when there is no blood or anything reaching this part of the body. So you are at the point of amputation. Because it's not spreading. If you allow it, it's going to keep spreading and it's going to lead you to death. So at this final stage 5, the only way out of it is to get rid of this leg once and for all. All right. So this is the stages. First one is stage 0. So stage 1, stage 2, stage 3, stage 4. This is the progression. Okay. This is the progression of your feet. Okay. So this is the progression on your feet. This guy says, I have the numbness in my hands. So if you have the numbness in my hands, so you are the early stage. I listed the early stage. What is that early stage when you have numbness in your hands, in your feet? Let me go back. A loss of, let me see what is burning, tingling, no, burning, tingling. So you are at the early stage, number 2. You are at the early stage of number 2, numbness, that is loss of sensation or the ability to feel heat or cold in your feet. So you are at the early stage, you are the number 2. So to avoid reaching this final stage, you have to control your sugar level. You have to take it seriously because once it gets in here, you see, because you are the number 2 now, because you have numbness, that is loss of sensation. Now, since you are number 2, pray you don't have any injury, any cut, any blister that is going to open or have an open skin in that area of your feet. Because the worst thing that can happen to you now that you are at this early stage is when you have a sore in that area or an open wound. That is when this problem starts. That is when you start going into this ulcer problem that is going to lead you to an amputation. So now that you are the numbness at the early stage, to avoid getting to stage 5, where you have to develop gangrene, is to make sure you deal with your sugar level, control your sugar level now, get rid of it. Because you are at the early stage, number 2. I listed it there, number 2. And pray, make sure you avoid anything wound, anything cut that is going to expose your wound, your body in that particular area. Because once you have a cut in that area or wound or blister, that is when your problem begins. Because one, you are not controlling your sugar level, you have an open wound, then it starts from stage 0, stage 1, stage 2, stage 3, stage 4, stage 5, when you have to develop full gangrene, and then the way out is amputation. So now that you know that you are number 2, early stage, the only way out is now change your lifestyle and control your sugar level. All right. I'm trying to see what you say. Can you, somebody asked me a question, can we use this for blood flow? To use what? I don't know what do you mean. Can we use what? You say, can we use this for blood flow? What is that? I don't understand. You didn't tell me what you can use, because you just say, can we use this? And I did not see what you want to use. So you have to show me what you want to use. Somebody asked a question here. He said, can we use this for blood flow? You ask a question, but what do you want to use? You have to show me what you want to use. Then I will know if you can use it. Okay. So this is the stages. All right. I've given you guys 11 stages. They are in sequence from 1 to the last 11. Okay. So you have to look at those from number 1 to number 11 to know what is happening to you around your feet, to know where you are. Okay. You have to look from number 1 to number 11 and look at the symptoms you are having around your feet and know where you are, and then to avoid this last stage 5, to start controlling. Everything have to do with controlling your sugar level to avoid those complications. Okay. So the next thing I'm going to, diabetic pain that spread. The next thing I'm going to discuss here now is this. The next thing we are going to discuss now is this. Diabetic pain that spread to your leg. After that, we're going to discuss the signs of diabetic foot. The signs of diabetic. After this topic now, we're going to discuss signs of diabetic foot. All right. So now somebody asked me, oh, is that what you're asking me? Because she asked me, Juma says, can we use this for blood flow? So I did not know what she was asking me. And then she asked me that this is what she's referring, Cialis. No, Juma, Cialis is not for blood flow. Please don't put me in a problem with the Facebook. Cialis is not for, Cialis is for erection. Men that are having ELD, erectile dysfunction due to diabetes complications. If you don't control your sugar level, it might damage your nerves. If you leave your sugar level uncontrolled for a long period of time, it might damage. If you're a man, it's going to damage your nerve for you not to have an erection as usual before. Or you might have an erection, all of a sudden, you are the type that used to have an erection for 10, 20, 30, 40, 1 hour. But you become diabetic, you're not controlling your sugar level, then you start having an erection problem that you cannot even, all of a sudden you see that you can't have an erection for a longer period of time to satisfy your wife, your girlfriend, or whatever. Then you start having problem of an erection. It's for ELD. So those that are having that their nerves in that area have been damaged, that cannot have a proper erection, will now use, there are different medications. Cialis, of somebody asked me a question. That is why, asked me a question that the drug that the doctor prescribed to him, he's not working properly. Can I suggest another medication? And that is why I listed Cialis or Viagra. So for those men that are having erectile dysfunction due to diabetes complications, it can damage their nerves. It can also happen to women. In women own is different. Women own in terms of loss of appetite. You know, there are some women before they enjoy intimacy with their husband or their boyfriend, all of a sudden they become diabetics, and diabetics damage their nerves. Now they don't like it anymore, or they don't feel it. Okay, they lost interest in terms of intimacy. This is a woman that used to enjoy intimacy with her husband. All of a sudden, when you mention it, it becomes an irritating something. So it damages those nerves that they don't like it. In men, it's different. In men, is that they don't have an erection. So they use Cialis or Viagra or other medication to give them to have an erection to enjoy intimacy. So that's what I'm trying to add. So it's not for blood flow. All right. All right. So I just want to explain properly. So now that has been answered, let me get rid of it. Now let's go to diabetic pain that spreads to your leg. Let me remove this picture. I have more pictures to share with you guys on this. Let me remove it. And then let's talk about diabetic pain that spreads to your leg. Okay. Why leg pain is not a common symptom of diabetes. Okay. Leg pain is not a common symptom of that. It can occur as a result of peripheral neuropathy. We've discussed that, due to uncontrolled diabetics. So having a leg pain is not a regular occurrence for people with diabetics, but it can occur as a result when you're having a peripheral neuropathy due to uncontrolled diabetes. So when you're having that neuropathy that involves your leg, typically leads you to the following symptoms. So what are those pain that spreads to your leg? Okay, what are those pains that spreads to your leg? One is pain that starts in your toes and gradually spreads towards your nails. One, okay. What are those pains that spread to your legs? One, okay, is pain that starts in your toes and gradually spread towards your knees. That is one. Two, okay, two is pain. Two is pain when you walk. All right. And then three is changes, the pain that changes in the way you walk. Three is the pain that changes in the way you walk. That is three. And then the last one is pain that occur when you have loss of balance, causing more force. You know, there's some pain that you have, that pain, it makes you to lose your balance and you start falling. So those are the pain that spreads to your leg. Okay. So now let's, I cannot take a break because Benson is monitoring me to make sure I stay on track. Benson, are you still there? Okay, so that is why I'm concentrating before he tell me, hey, get back to track. Benson, are you still there? Are you still keeping me on track? So let's talk about signs. This is what we're going to discuss now. Sign diabetic foot is progressing. So we're going to discuss sign that diabetic foot is progressing. Is Benson still there? Because it's because of Benson I'm keeping on track. Okay, is Benson still there? Okay. Benson is gone. Benson is gone. All right. So what are the signs that diabetic foot is progressing? Okay, I shared a picture earlier on. Okay, I shared a picture earlier on to show you that your diabetic foot is progressing. Those were from stage 0 to stage 5. It's the same thing. So that's how it progressed. So it's the same image. So diabetic foot problem progress at different rates depending on the way my diabetic foot is progressed might be different from yours. If I'm controlling my sugar level 50%, the way it's going to progress will be different for somebody who is not controlling their sugar level at all. So the progression of your diabetic foot problems are different depending on your condition. Okay, diabetic foot ulcers typically progress, okay, so that the wound worsens until it eventually involves your entire foot. Okay, so that is this picture that I shared earlier. Okay, that is this picture that I shared earlier. Let me see. Yeah, this picture here. Okay, this is the signs. This is the signs that your diabetic foot is progressing. Okay, because as I said, repeating it again, the way your foot problem progress, we might be diabetic at the same time, but somebody is having 50% progress, 50% getting hold of the diabetic situation, and you that is not getting, you are not even, instead of you are not even getting 1%. It's getting worse each day by day. So the person at 50% controlling their sugar level, Their food problem, the way it progresses might be different from yours. Yours is going to be more faster because your sugar level is building up at a faster rate than somebody trying to keep it down. The progression is going to be slower. So these are the signs. It's going to start from 0 and then go to stage 1, stage 2, stage 3, stage 4, and then the last one is when the gangrene has taken hold of all your food. So now I've told you guys on stage 0 is when you have a normal looking skin with bony deformities that indicate a food at risk. So stage 0, your food are still intact. There's no any deformity, but it looks nice, but it's not entirely nice. All right. Now it goes to stage 1 where you have superficial food ulcer. Then it goes to stage grade 2, grade 3, grade 4, and then the final stage, which is when you develop a gangrene, which is the entire food. So those are the signs. Okay, so I'm not going to go back. I'm not going to spend more time there because those are the signs of this. So I'm trying to rush. I'm trying to rush. Still have a lot. It's going to take me another hour to finish this. We're already 2 hours here. So it's going to take me another hour to finish the program. So that's why I don't want to spend much time on this. All right. Now, it's going to take me another hour to finish this topic, this program. All right. I'm going to see how it goes. So those are the signs that the diabetic food is progressing. Okay. Now, what are the risks of untreated diabetic food problem? What are the risks of untreated diabetic food problem? If you're not treating your diabetic food problem right from day one, you see the symptoms, early symptoms. What are the risks if you leave it untreated? Okay. If you leave it untreated, what are the risks? Can somebody tell me what are the risks? Benson, where are you? You've disappeared or run away? Okay. So when you have untreated diabetic food problem, it can include these complications. It can include ulcer and infection that do not heal, resulting in loss of a foot, your leg, or your life. So if you have, okay, let me put what I'm discussing now. Are you guys hearing me? Can somebody let me know? Because everybody is quiet. Are you guys hearing me? I want to know if you guys are still there. Can somebody confirm? Are you guys still there? So we're going to discuss risk of untreated diabetic foot problem. Okay. All right. So this is what we are going to discuss now. What are the risks of untreated diabetic foot problem? All right. I can see you guys. What are the risks of untreated diabetic foot problem? So what happens when you leave? Okay. So nice, you are there. So what happens when you have untreated, you have all this issue and then you leave it untreated? Number one, ulcer and infections that do not heal will result in the loss of a foot. You might lose your foot, you might lose your entire leg, and you might even lose your life. That is why I shared this picture in the beginning. Let me go back to those pictures again. Let me bring that picture back. There's one picture I shared at the beginning. I'm going to go back. Okay, this picture, I shared it at the beginning. This picture here. So if you live untreated diabetic foot, the complication can result ulcer like this. From ulcer, infection will penetrate. And when infection penetrates, this is your skin. See that picture I'm showing there is your skin. Okay? You might lose your foot, your leg, or your life. How does these three things occur? Remember that picture I'm showing you guys? This is your foot. Okay? When the wound is at the surface of your body, it can be treated. The only way you have to control your sugar level so that healing will start. Because that time is not yet, there's no infection. All you have to do is bring down your sugar level constantly, healing will start. As long as you have too much sugar in your blood, no healing. But if you leave it untreated and infection penetrates, it will not spread. What that infection is aiming to the bone, to where the nerves are and the blood vessel. Because that is what is going to give it oxygen to carry that infection and spread it through the bone that is going to now lead you to your life. So once it starts penetrating, you can see the picture there from the top of your skin, it's going down. Infection is not trying to spread. It tries to goes down this way. It's aiming towards the bone. Because where the bone is where the nerves and the blood vessels are connected. You can see at the bottom there, you can see the nerves and the blood vessel touching the bone. So it is penetrating, the infection is going deep. It's not going this way. It's aiming towards the bone. And once you get in contact with the bone, bam. That is when you see you as a patient, you could see changes in the way you breathe, the way your temperature rises, everything changes, your heart rate changes, and then they'll check your bone. And once they see the infection has touched the bone, it is spreading like a wildfire. And that is when doctor will now come with the bad news to your wife, to your husband, and say, woman, the only way to save your husband is the infection is not spreading fire. To look where it's in the bone, and then so we are going to cut from here out to save here and save your life. So if you have ulcer or infection, an infection that do not heal, as you're seeing in that picture, that can result in the loss of a foot, loss of your entire leg, or your life. That's one. Okay. Let's put it out there. I don't want to put it, I just want to put it out there. This is what happened. Okay. This is what you are seeing in that picture. Okay. Now, the next thing is corns and calluses that can develop into ulcers. Corns and calluses can develop into ulcers. I'm going to share you guys a picture of what it look like. Okay, let me look for a picture of it. Okay, I'm going to use this picture. I'm looking for another picture. Let me see. I have a better picture here. Okay, yeah, I'm going to use this one. Okay, number 2, corns and calluses can develop into ulcers. Okay, so it's going to start something like this, superficial outside. Okay, this is ulcer and infection that do not heal. Okay, that's number 1. Then it's going to develop something like this. Okay, it's going to form like corns. You know, corns at your heel. Can I just hold on? Let me see if I can get a picture of it properly. I'm trying to see if I can get a picture of it properly. Okay, I can't get a picture. This picture is credit to, I can't see the name, but it's credit to iStock, okay, for using your picture for this illustration. Now, Now it's going to start, corns. We all know what corn is all about. At the base of your feet, corns can start at the base of your feet. Okay, those things that you have to, when we are taking our bath, use a stone to smoothen it. Okay, so it's going to develop like a corn on this, or sometimes it can develop a corn on top of your, at the in your toes here, at the edges here. Okay, so it can develop as a corn or calluses. Those are calluses, superficial. Okay, and those things then can develop into ulcer. So at the early stage of corns, you know what? Just hold on. I'm gonna get a better picture of it. Just hold on. I'm gonna get a better picture of it, because some people might not understand what I'm talking about. Just give me. I'm gonna get a better picture of it. Corns. Okay, yeah. This one is much better. Let me look. Oh, perfect. Okay, perfect. I can use this picture. Credit to who? Credit to Prazit. Okay, I can use this picture. Credit to Prazit. Hold on, I'm getting a better picture now to use, because I want to make sure you guys understand what I'm talking about. Okay, Credit Prazit. 255. Okay, now 255. Okay, I'm gonna use this. I got a better picture to use now, so let's go. Okay, let's use this picture now. Okay, this is the picture here now. Okay, look at this picture here. All right, you can see the corns here at the back here. This picture, credit to 255. Credit to 255 for using your picture. You can see at the base, you see the corns here at the heel of your feet. You can see how it is now getting a small cut. You can see the skin here. Look at the skin here, how it's getting rash. So this is what we call corn. Okay, if you don't I remove that picture here. What am I'm trying to, let me get that picture back. I'm gonna get that picture back. Okay. Let me go back to you. I'm gonna go back to share that screen. Yeah, this is what I want to share. Okay. All right. So we are back now. So this is what I want to see on this picture. Credit to Tua for using your picture. All right, and this now this is corn. Okay, so if you have untreated diabetic foot, it's going to develop as a corn at the base of your feet. Now that corn or calluses, okay, that corn can turn to calluses, like you have a small cut. See how it starts this small cut now? Cannot develop, this little cut now can develop into foot ulcer. Okay, so you see how the corn, we all know what corn is, start at the heel of our base, sometimes at the top here. Okay, this small cut can now, because infection now can penetrate in there to be a foot ulcer. All right, so that is what I'm talking about. Number 2, corns and calluses can develop into foot ulcer. That is number 2. Credit to Toa for using your picture. That is number 2. So that's what I mean by cons and calluses that can develop into ulcer. So that is why you have to check your feet all the time. Check your feet all the time. All right. There's another one again that is small. Let me stop this. I'm going to share another picture. Let me bring another picture. Oh, this one is going to get there. All right. I'm going to use this picture. Okay. You see now, this is another picture. These are calluses. Okay. This is the real calluses. Now look at the base of this feet here. You can see how it's turning. Okay. Those corns can turn into ulcers. And that is how, when you start having all these open wounds here, infection can penetrate and they now develop into foot ulcer. So let's go to number 3. Okay, untreated diabetic foot can cause you to have the same thing. I'm going to use this picture, a dry skin, dry, cracked skin that can lead into sores and infections. That's number 3. Okay, it can lead you to have number 3, the same picture. Can you see the same picture? That's number 3, dry, cracked skin that can lead to sores and infections, because these are dry skins, there are cracks, and there are the blood vessels are open. Infections can penetrate through these open blood sores, this open wound that can penetrate in there. That's because this skin is open, so there's a possibility through this dry, cracked skin infection to penetrate and then start aiming to the bone. That can make you to lose entire foot. Or if possible, you see how it is spreading up? You see how it's spreading from here, going, still how it's spreading, going up. If you don't stop it from here, okay, once it touches the bone, it can now start spread. You can lose the entire foot. They amputate the entire foot to save the leg. If you still don't control it, it can spread. To see how it is going up, it cannot be going up, and then you might lose the entire foot, entire leg. Because this is your foot, this is the leg here. All right, so let's go to number 4. Okay, let's go to number 4 is this picture. Credit to Praxit. Praxit, credit to you for using your picture. Okay, Praxit, credit to Praxit. So number 4 is this: muscle weakness and loss of tone in your feet, resulting in deformities like hamartomas and bunions. So you might lose weakness in your muscle weakness. As I said, if you go back to that picture I showed you, when the infection starts going down, because it is cutting through the muscles, because it is going down deep, it is not going this way, because the aim of that infection is to reach the bone, the nerves, and then the blood vessels, and then start spreading across. And once it is going down, it is cutting across the muscles. There are different layers of your skins, and as soon as it's going down, it is cutting through the muscles, and that is when you start developing muscle weakness. Because once the infection is going down, it is cutting across the muscles, and that is when you start experiencing muscle weakness and loss of tone in your feet, because the muscles are now they are not connecting. So you start experiencing muscle weaknesses and loss of tone in your feet, resulting in deformities around your legs. That's why you see some legs are bent, deformities, the toes are bent inward, and all these things start because the muscles now are disjointed, or they are cut, sliced into two due to the penetration of the infection. Okay, so, and then we'll go to number 5. What happened if you develop what is called charcoal foot? Number 5, you develop what is called charcoal foot. You develop what is called charcoal foot. And that's going to lead you to have PAD when you have peripheral artery disease, because of lack of blood flow in those areas, which is number 6, the final one. Okay, is number 6. Okay, you have PAD, which is a peripheral artery disease that's going to, because of poor blood circulations. All right, so this is what happens when you have untreated diabetic foot. Do you guys understand now? Do you want me to continue or stop here? Because it's going to take me another 45 hours, 45 minutes to finish. Do you guys understand? Are you guys following? Should I stop here? Because I see most of you, everybody have disappeared. Those that have been put, Benson that is been monitoring me is gone. So this is what happens if you have untreated diabetic foot. Should we stop here and wait for another time? Because I still have to discuss about a lot. I still have about 6 more topics, 6 more subheadings to cover up here. So Bia says we are okay. Nega says we are following. Because I can see the viewership is drawing. Because I can see the viewership dropping. When I see the viewership drop, people viewing are dropping, then I know that people are going. So maybe I'm spending too much time. You know, there's some people that are using their data. So when they cannot, their data run out, they drop off. So that's why I'm asking if I should stop. So these are what happens if you don't treat your diabetic foot. Okay, so this is what happens when you don't treat your diabetic foot. So I'm going to jump. I have about 5, 6 subheadings on this topic to finish up, but I'm going to jump some and discuss. I'm going to jump some and then go for the now there are some accessories that you might need if you have a diabetic foot problem. There are some accessories that you might need. I could remember I did a video of a compression socks. There's one video I did about socks. I showed you guys about socks. There's something they call compression socks for diabetics. Okay, there's a special socks for diabetics you wear around your feet. Okay, so, and there are some shoes, because when you start having deformities in your legs and you start having these nerve damages around your legs, you might have a loss of balance. You might have a loss of balance because now there's deformities. Your foot are not more straight because the nerves have been damaged. You're having a PAD in those areas. You don't have any feeling in those areas. You are feeling cold or heat. Now, there's something we call compression socks. There's a video I did and I showed you guys about that socks. People did not watch that video enough. I look at the view. The view is so low. Maybe people did not catch up. What is that socks all about? There's a compression socks for diabetics. You might not take it seriously. I put that video there. People did not watch it. But there comes a time if you don't control your sugar and you start having deformities in your legs, in your foot, or you start feeling too much cold or hot in your feet, that is when you need that socks. And you remember why I did that video about compression. They call it compression socks for diabetic foot. Those are the accessories. You see some people that are diabetics and you see them wearing socks all the time, even when they are outside, because sometimes you see them, the weather is hot. Why are you wearing socks? They cannot do without that socks. Or sometimes you see the weather is cold. Every time you see them, they are wearing that socks because there's a problem in that foot, in that feet. They are diabetics. That is where you need a compression socks for diabetics. Okay, that is when you need a compression socks. And there's also some shoes, because when you have deformities in your legs, there are certain accessories that you might need. You might need a walking stick to get a balance. You might need a special shoe customized according to your foot, so that you can aid you for walking and then to maintain a balance. Maybe you've not reached to that stage, But these are certain things, if you don't control your sugar level now at this early stage, it might lead you to start needing those accessories in terms of walking sticks, in terms of those special shoes that you have to wear because of deformities around your feet. And then you might be needing a compression socks at all times. I did a video about it. People did not watch it, but I know people might not understand when I'm showing them socks. They say, what is, I know people will think, oh, why are these guys showing me socks, telling me about diabetic foot socks? What is it all about? Hey, guy, maybe at this stage, you still have a nice foot, but there comes a time that you might, in your foot is completely dead and you are feeling cold all 24/7, you are feeling cold, you might need that socks. The doctor is going to recommend you to go and get a compression socks for diabetics. Okay, so that is what is called compression socks. Okay, I just posted it now. Okay, compression socks for diabetics foot. Your doctor is going to recommend for you to have it. And the benefit of wearing compression socks for diabetics foot is these socks encourage your blood to flow by gently squeezing your leg. Okay, that is what is called compression socks. I did a video about it. Go on my page, the video there. I know people do not watch it. There's no view. I watch it, and people that watch it, I know people might not catch up what it is. But there's something we call compression socks for diabetics. Okay, so those are the accessories, and there's a special shoe for it. Now let's talk about at-home monitoring and care for food. Okay, this is what I'm going to discuss about it, because as I said, this is what I'm going to discuss. When you are at home, what are the things? As I've told you guys what you're supposed to do when you're at home. How to monitor? You have to check your food all the time. It is important you check your food all the time when you're at home. Anywhere you are, as long as you're diabetic, you have to keep an eye on your food. And also sometimes, first use your hand and touch your food to see if you can feel sensation. Or ask your daughter, ask your husband, ask your wife, anybody to say, please, can you touch my feet? And see if you have any feeling sensation indeed. And also put a heat, go around near a heat to see if your leg can feel heat. Also dip your foot into an ice cold water to see if you can feel it. Those are certain things you can do at home in monitoring and care for your food. Okay, so at home, monitoring and food care can help you catch symptoms of diabetic foot early. This can facilitate faster treatment or reduce the risk of amputations due to complication of diabetes. So the things I just mentioned to you is the way you are going to monitor at home before it gets to a doctor, gets to you to a doctor. Now, controlling your blood sugar level is the first thing you have to do all the time. Why we are having this problem now, or why you are having this problem now, is because you are not controlling your sugar level. You've allowed your sugar level to reach to that point that is now causing you to have these complications and start damaging and destroying your nerves, your blood artery, blood vessels, and other organs. As I said to you guys in the beginning, when you have excess blood sugar level building up in your bloodstreams and they are floating around, that time they are floating around, not going anywhere, it is when they are causing those problems. Because your blood, as soon as it, let me put it in another way. Let me put it in another way that you guys are going to understand. Excuse me, just for 1 minute. I'm going to step away and come back. I'm going to switch off something. I'm getting a signal. I have to turn it off. Just 1 minute. I'll be right back. Okay? I'll be right back. bad. Sorry about that. All right, let's finish this program so that I can. Okay, now the reason why you are having this complication is because you are not controlling your sugar level. So to avoid all these complications, you have to deal with your sugar level to avoid these complications. So controlling your sugar level to remain in the target range is the best way to protect your feet from nerve and blood vessel damages. So let's look at the steps to ensure you take proper care of your foot. Okay, what are the steps at home before it gets to your doctor? I'm not going to put them in the comment section, so I'm going to just go through them, and then let me give a credit to my pediatricians for helping me to prepare this topic today, because I'm going to give a shout out to my pediatricians that helped me to prepare this topic. Dr. Amzat, I thank you very much for being with you throughout yesterday, have an insight about food care for diabetics. You're giving me a guidance. It's not easy to spend 2 hours with you yesterday in preparing this topic for me today. I hope you are watching, and I'm also seeing your comments in guiding me through and make sure that I present it correctly to my fans that are watching. And I could see you are giving me, I could see I'm following you on your page to see that you are following and putting me straight. So I'm going to give a shout out to Dr. Hamzat for guiding me throughout yesterday in preparing this topic. That is not my specialty area, so I have to get an insight to guide me through. So it is not easy, okay, because you can't just sit down. I have my own area of specialization, so you got to, sometimes I have to see a dietitian, a nutritionist, sit down with them, and then to make sure I present accurate issues regarding diabetics. So Dr. Hamzat, I'm thanking you, giving you a shout out to guiding me yesterday in preparing this topic. And also the stock images that I'm using are not mine. To those that I'm using their stock images, I'm giving you credit for using your stock images to present these topics, because you have to do that so that you cannot be labeled copyrighted. So I have to protect myself, protect my page against Facebook rules. Once we are using somebody's image, you have to give them credit. Let them know that you are using their images. And once you are done that, you are protected from copyright. So that is why I'm using stock images to balance my illustrations. And I've given a shout out to those stock images. So now let's go to what you have to do at home. Okay. If you're having for you to get to a stage where you'll be needing a specialist for diabetic food, it has to start from your doctor. I don't know. I know in Africa, some other areas, other countries, you see one doctor have to do this, have to do that. No, everything, like here I am. There's a boundary that you can operate. Once it reaches that boundary, you have to refer to a specialist to take over, and that specialist is going to advise your family doctor on what to do. Okay, like I give you an example. When I did my thyroid, there come to a stage it has to be pushed to a specialist to take over, and that specialist is going to take over to treat that area, and then advise my family doctor what to do to continue. But in Africa, you see everybody have to do everything. No, it has to be, you know, where your boundary to operate. The same thing when you're having a food problem related to diabetics, you'd have to refer you to a specialist in that area to take over and then advise your doctor once he or she has finished on what to do to continue that treatment. So these are the things you have to do at home: is examine the tops. Examine the tops and the bottom of your feet for changes. I've said it in the beginning of the program. You have to check your foot, in around your foot. Like example, this is your foot. You got to monitor your foot, check everything all the time. If you cannot see the bottom of your food, put a mirror on the floor, put your food and see if there's anything. If you have a husband, a daughter, a son, let somebody check it for you. Also, in between the toes, do not just look and then feel it. Put your finger there to feel there's no any roughness, anything that is suspicious in between your toes. Okay, so examine the tops and the bottom of your feet for changes such as cut, redness, sores, blisters, or other changes to the skin or nails on your feet. Use a mirror to help you examine the bottom of your feet. That is the first thing you have to do. Okay, examine. Okay. Okay, so now, Mbia, I'm gonna come to your question. All right. Okay. So now we are looking at home monitoring. The first thing you have to do is what I just repeated. Okay, what I just repeated here is number one. Let's look at number one. Okay, number one is this. Okay, at home, examine the tops and bottom of your feet for changes such as cut, redness, sores, blisters, or other changes to the skin or nails on your feet. Use a mirror to help you examine the bottom of your feet, is what I just explained. That is number one. At home, things you have to do all the time if you're diabetic. Okay, that is number one. All right. Now, Mbia says, I'm a general practitioner. Kindly assist me with a pediatrician's contact to learn more. Thanks. Mbia, you are watching from where? You are watching from where? Can you tell me where you are located? Okay, you are in Zambia. Okay, you are in Zambia. All right. You see, okay, you're a general practitioner. Good. All right. You see, the location is a problem. Like you're in Zambia, I don't know any pediatricians in Zambia. Okay, I don't know any pediatricians in Zambia that I can give you in contact. I don't know if that is what you are asking me to do, to give you somebody in Zambia. Okay, to get in touch to discuss with you. Now, I don't know if that is what you're asking because I don't know anybody in Zambia. Okay, to say, okay, there's no one in Zambia. Okay. All right. Okay. So you need okay, I'm gonna, you see, one Mbia, what is gonna happen is that and now I know that you're a general practitioner in the same field. You see, if it is here where you know, we know ourselves. What I'm gonna do is, I can't make any promise now. I'm going to try to see how I can help you. All right, how I can help, because first of all, let me thank you. I don't now know that you're a general practitioner. I know what you guys go through in Africa. A lot of doctors are fleeing Africa, coming here to practice. I know what you guys are going through in Africa, doctors going in Africa. As I said, Africa produces the best doctors in the world. We have the best doctors in the world. In African continent, when it comes to this Western world, we have the best surgeons. We have the best practitioners, specialists here in the Western world. They school in Africa, get educated, but because of the bad governance there, they come and snatch them away and bring them here to come and practice. Because here, everything is provided for you. The government appreciates doctors, specialists. In Africa, they don't give a damn. They don't appreciate you. So I know what you guys are going through. And like now you can see, you are a general practitioner. You don't even have a specialist in Zambia to assist you. Okay, so I know what you guys are going through, and I'm going to see how I'm going to try. One thing with here is that the way it is regulated here is, here you're going to be serious. If you're in the field of medical, you're going to be serious because it's going to be rare. I used to give an example that in Western world here, you're a doctor, a gynecologist, or a general practitioner, and you have a patient that died in your practice, one doctor in government is going to just overlook it. But once you have a patient die in your hand twice, they will try to investigate why is your patient dying. But in Africa, you see, in a clinic, somebody die, the government say, oh, no, leave him. But here, once somebody died in your practice once, doctors are going to just, okay. But once it occurs twice, they look into your practice and know why is patient dying in your practice. So they take it seriously. Or you have a woman gave a birth, died the first time, second time died, they take it seriously. They know there's something you are doing wrong. Why should a woman die? It's in Africa, I see somebody, a woman dies 1, 2 in a practice, they keep allowing that doctor to keep practicing. Without investigating why is childbearing, why a woman comes to your clinic and die 20 times and they still allow you to practice. So I know what you guys are going through. So for me to hear now that you don't have any pediatrics in your state, in your country, is painful. I know what you're going through. I'm going to try and see how I can help. But one thing is it here, most specialists, except we are our friends, my friends, they can spend 20 minutes with you. So, okay, I'm going to give you 20 minutes of my time. But if you see a specialist that is going to give you every time, give you even 1 hour, he's going to charge, he's going to bill you. That's what I say, I'm not going to make any promise. I have to speak to them to see if they are willing to be communicating with you over the phone, because most doctors, they will bill you for their time. For me to get even a 2 hours is because we know ourselves. Sometimes they may need my help, I might need their help. So it's a give and take. Okay? And then to know you are trying to help. So I'm not going to make any promise, but I'm going to try to see if I can get one to communicate with you, but to see if they're going to be flexible, because everybody's busy. So in Bia, I believe you're hearing me. So I'm going to try to see. I'm not going to make any promise now, but my line is open to you. I'm going to, after I message me in my inbox, in my page, message me in my inbox, or I'm going to give you my WhatsApp number. I'm going to message you my WhatsApp number that you can reach me personally on my WhatsApp. In terms, if you need any help, okay, we can see how we can collaborate between both of us. But I'm going to see, as I said, I'm not going to make any promise until I'm sure I can get even one. Then I'll be able to say, okay, because here they will bill you for even 30 minutes. Nobody, specialists here, nobody wants to waste. They will bill you for even 30 minutes of their time because they are busy all the time. So, but here we know how we help ourselves. So, but I'm going to put a word out there to see. I have been trying to get, like for instance, now I've been trying to get even one specialist on my program, like this live program, to come and sit with me. Let's have a live program together. But I couldn't. I've been trying to talk to my friends to see, can we have a live program? Get some specialists to come on the live programs and do a video live program. Anytime we fix a time, something comes, they cannot. And most of them will tell you, okay, I'm going to do it. Within the last minute, something comes, they need their time. They say, you know what, we're going to cancel it because they have to go, because the money They cannot. They cannot speak even to, because that money they want to go and get it. They rather spend it in a hospital and get a big pay than come here. So I've been trying to see how I can get one or two on a live program, but each time everybody is busy. So for you to see, I cannot even get one. Even most of my closest friends, time. Specialists is time, especially when you're dealing with a specialist, they don't play with your time. So I will try and see if I can get one to communicate with you. You know, if you are here, that's a different thing. But you in Africa, for them to call you, spend 20 minutes, 30 minutes. I'm going to try. As I said, I'm not going to make until now, but I'm going to try. But I'm going to message you my inbox, my WhatsApp number, so that we can see, we can get in touch. We can collaborate personally, so you can get in touch with me personally, and then see what we can collaborate with you and see how I can help. Okay? In terms of knowledge sharing, in terms if you need guidance, then we can see how we can discuss, communicate over the phone. All right. So Mbia, let's leave it at that for now, and I'm going to see what I can do in terms of if I can get one. Okay, but I'm going to I'm going to send you my WhatsApp number on your page. Okay, I don't normally share my WhatsApp number, but I'm going to share my WhatsApp number in terms, if there's any time you need, in terms of share ideas or something you are, in terms of, you can reach me, and then we can now discuss further. All right, Mbia. But once again, I'm going to thank you. I know what you guys are going through there. As a doctor in Africa, governments don't take good care of our doctors in Africa. They don't give a damn. So once again, keep doing what you're doing, Mbia. So let's get back to what we're talking. Somebody, I hope Mbia, you understand what I'm trying to say, okay? So Samrita says, where can I get compression socks? Where can I get compression socks? Compression socks can be gotten in pharmacies. Okay, compression socks can be gotten in pharmacies. You go in there, most pharmacies have it. Okay, it's mainly special for diabetics. Let me see if I can see one. Let me see if I can see one here and show you how it looks like. Just hold on. Compression socks for diabetics. See if you go to Amazon, they sell them. Amazon, I don't know if they can ship it to Africa, or you go to most of your shop pharmacies, you see them there, they sell it. But there are a lot of them in Amazon. You can buy them in Amazon, but I don't know if Amazon can ship to Africa. Okay, but let me tell you, let me show you how it look like. I did a video about it, but it has to be specifically written. If they're going to write it in there that this is for diabetic. If it's not, don't just go and buy any diabetic, any socks says, no, it is mainly for diabetic. Okay, it's going to be written in there that is for diabetic. Let me see. I'm trying to find one. Just a minute. Just. I'm trying to see if I can see one here and share with you guys. Oh God. Okay. All right, I'm going to use, let me see if I can. Okay. Okay, I want to share this with you guys here. So okay, this is what you see. This is what it looked like here. Okay, you see, it's going to in the see diabetic source there is going to be written diabetic on it. Okay, it's a special socks. You can don't just go and buy any type of socks. It must. It says the way they package it is different, and on it must be indicated that this is mainly for diabetics. Okay, because if the compression socks, the way it feels is different from the way normal socks feels. The way a diabetic socks feels, the texture, the way it feels, the way it stretches, the way it holds your feet is different from the way a normal socks feels. So don't just go and buy a different type of socks and use. Okay, so this is, you're going to see it's there written diabetic socks, compression socks on it. So you can find them in most pharmacies. Okay, most pharmacies sell them, or if there's no any big pharmacy there, not all these chemists on the sides road. No, those chemists cannot go. It's a big pharmacies, well organized firma, or can sell it. Or you go to Amazon. Amazon has a lot in Amazon. I don't know if you buy it there, if they can ship it to you in Africa. I don't know if Amazon can ship it to Africa, because certain times they tell you they're not shipped. So you got to find out there, you know, if you can buy them from Amazon. Okay. All right. So let's remove this. So let's try to finish up what we are talking in. Let's try to finish up what we are talking here, and then let me remove this. Okay, so let me remove this. Mbia, are you still there? Where am I here now? So we did number one. We're talking about how to examine your feet at home. Let's go to number two. Number two is you have to wash. You heard what I said, but Mbia, you heard what I said. Let's try to go to number two. All right. Let's go to number two. You have to wash your feet with warm water and soap daily. Avoid soaking your feet, which could dry them out. Okay, avoid washing your feet, soaking your feet, which could dry them out. After washing your feet, dry them completely and apply moisturizer to the tops and bottom, avoiding between your toes. Okay. Number two, things the way you manage your feet at home. We are still talking about home care for your feet. And number two is that's number two. Okay. You wash your feet with warm water and soap daily. Now avoid soaking your feet, which could dry them out. Okay. After washing your feet, dry them completely and apply moisturizer to the tops and bottom, avoiding between your toes. All right. Okay. Now let's go to number three. Number three is wear shoes and socks that fit properly to avoid causing irritation or sores from friction. You know, sometimes you're going to wear some shoes that are so tight to your feet. That means it's not your size. Those frictions between your shoe, your foot and your feet can cause you sore opening, and that's how it begins. Remember, you're diabetics, you have to avoid wounds, cut, anything that is going to open your skin to cause abrasions, abrasions in your skins. You avoid them. So do avoid wearing shoes that are so tight. Once there are always a frictions when you walk, you see that open wound can become the beginning of your problem. You know you're diabetics. So wear shoes and socks that fit properly to avoid causing irritation or sores from frictions. That's number 3. Then let's go to number 4. Okay, let's go to number 4. Is never walk barefoot, even indoors, to avoid injury. I've said it to you guys, avoid injury at all costs if you're a diabetic. Check that small pebbles or other materials do not become stuck inside your shoes, which can irritate your skin. What we call about pebbles, small pebbles. Remember, sometimes you put your socks or you put your foot in your shoes and you notice like something like a sand touching your foot. You know, you notice there's something underneath inside that shoe. That is what we call pebbles, materials. You see, then sometimes you're going to remove your foot and turn your shoe upside down and shake it for that sand, that thing to come out. Yes, that is what we call small pebbles or materials. So once you put your foot and you feel there's something irritating you, remove your socks, dust it up, remove your shoe, remove it, and then put your feet back. Because those things there can cause you friction and cause you injury. Okay, and once you are inside the house, never wear barefoot. Put something. Okay, at all times, avoid injuries at all times if you're diabetics. And then if you have an elderly parent, okay, if you have an elderly parent, okay, at home that is diabetic, that is why I've said it in the, if you guys have been following me and be watching my programs, if you have an elderly parent, make sure you have a caregiver with them at all times. Okay, make sure you have a caregiver with them at all times. My mom, I told you guys the story of my mom. Has been a diabetic for almost getting to 40 years now. I have to provide her 2 caregivers at all times. I have to make sure they have 2. She has 2 caregivers at all times. My mom can never be alone without somebody. And why I provided 2 is in case my mom sent one to the store, to the market to go and buy something, there's one with her at home. So in case if she go fall or try to fall, there's somebody to hold her. So my mom can still walk, but I need extra one at home with her at all times. She's going to the bathroom, somebody is standing outside the door to listen to make sure if there's anything like fall, she rush in there to save her. Because if you have an elderly parent, they can fall and hit their head somewhere. That assistant immediately can save their life. But you know, when they fall, they have kind of faint and they fall and hit their head, they might faint and feel dizziness and nobody to bring them down, and they might bleed to death. So that is why I have 2 caregivers. So when my mom sent one out, one is with her at all times. Anywhere she's going, that person have to be with her. And what I did in my house, what I did was in the bathroom, because I have to, her own bathroom, nobody can share the bathroom with her. I made it as a point of rule. Anybody that wants to use the bathroom can use other toilet, but this bathroom is specifically for my mom, and nobody at all times can use that bathroom to avoid infection. Okay, it is a rule in that house. You want to use another bathroom, there are several bathrooms in there. My mom wants to use that. My mom cannot use another bathroom. If she wants to use the bathroom, take her to her personal bathrooms, and it must be kept tidy at all times. Now, what I did was, before, when my mom wants to take a shower, that caregiver have to go in with her into the bathroom, bathe her. She can still bathe by herself, but I want somebody to be with her inside the bathroom, bathe her, do everything, and come on. So my mom, every time she said, no, I want my privacy. I said, Mom, no, you are at your age. You need somebody there. What if you fall? I said, no. So my mom, this becomes a friction between me and her. So what she normally do was, because it's my mom, she's the head, so she can give an order. So she told the caregiver, step out of the bathroom. She'll step out, and my mom will lock the door inside from the bathroom. And the one the caregiver, but she cannot open the bathroom anymore. And that becomes a worriness, even though she can still bathe. I put a chair for her there in case she can sit down there and bathe. There's a high chair for her. She can sit down there. I make the toilet. There's a toilet stool that I bought and I send it to her. You put it across the toilet, the seat of the toilet. It's like a stool. It's high. Because my mom at her age, she cannot bend. I don't want her to bend down. So the stool is a chair, but it's high. She can sit on it and still relax without going down. So I made everything comfortable for her. But where I become uncomfortable is she's not locking the door of the key inside, where the caregiver cannot go inside. I said, Mom, what if something happens, you slip and fall, and you lock yourself in there? How can she rush in there and save you? It's dangerous. He said, no, I'm okay. So what I did was I sent in somebody there to remove the key and put the one that she cannot lock inside anymore. So I changed the knob of the key and put the one that she cannot lock it anymore. So now I've removed that power from her. So we all agreed, okay, the caregiver, don't go in. Since she needs her privacy, don't go inside there, stay outside the door, and then listen. In case if there's anything, you can open the door and rush in. So that is what we agree. I said, okay, the caregiver is not going to go in there anymore. She's going to sit out here while you take your bath, do whatever you want to do. But at least she can have access to open the door if there's any slip and fall inside. So these are the things you have to do to somebody that is at old age. They must have a caregiver at all times in case if they slip and fall and have an open wound. Okay? So make sure you don't. I'm only sharing these experiences as a diabetic, okay, for you guys to know. And if you're like, I will have a friend here in BIA that is a general practitioner. She can also learn from here and also how to educate their patients. These are the certain things you have to do. Okay, coming from a medical field, I also have to talk to people back home. These are things you have to do to make sure that you manage your diabetics properly. So never walk barefoot, even indoors. Make sure you have to cover your foot in case you hit your foot somewhere, you don't have any cut. So let's go to number 5. Am I correct? Yeah, number 5. Let's go to number 5. So number 5 is do not attempt to remove calluses or corns yourself with scissors, clippers, or over-the-counter products. Consult a pediatrician to address this problem properly. Okay, so number 5 is very important. Once you start developing those corns and you start having those blisters or clippers, go and this is when your doctor is going to require you to refer you to pediatrics. Just now taking care. This is a section for pediatrics. When these things start occurring, it's no more something a general practitioner, a family doctor is going to take care of. Is to refer you to a specialist to now do their work, get you back in order, and then send you back to your family doctor and then give instruction to your family doctor on how to treat you. That is how it works here. Okay, when it gets to, when there's a place is going to reach, I say, okay, I'm going to send you to a family specialist. You go there, do your job, and I'm going to wait for further instructions. Once they finish treating you, they'll send you, say, okay, you can now go back to your family doctor and continue. And then whatever the specialist is treating you, a copy is sent automatically to your family doctor on your record. And when he or she finishes treating you on that particular issue, you are okay, he's going to send you back to your family doctor to now continue with an instruction on how to continue the treatment. That is how it's there, because everybody has their division of labor. Okay, So now, so when you have corns or those calluses in your food that I shared a picture with you guys, you don't do it by yourself. Now the specialists have to come in and then now start to do their job. That's why somebody asked me for how long would you see a pediatrician? It depends on the severity of your diabetic foot problem. If it's something that is severe, you have to see them frequently until it is treated. If it's something that is on the early stages, they can do it quickly and they refer you back, put you back straightforward, teach you certain things, and they send you back to your family doctor with their instructions on how to treat it. Okay, so that is it. Now, one thing again, okay, okay, that's what I want to say now, but that is going to be number 6. So let's go to number 6. That's what I wanted to say now until I see it. That's going to be number 6. Number 6 is trim your toenails straight across using a clipper. If you cannot accomplish this, ask your pediatrician to do it yourself. This thing also, that's what I need to say in terms of cutting your nails, cutting your toes. Do not use razor by yourself. Do not use razor by yourself. One, if you're going to use this, you're going to do it across using clipper. Do not use razor. It's dangerous. Use clipper. Now, while you are using clipper by yourself, make sure you do not cut your skin. Some people will put the clipper inside and then they mistakenly cut their skin. Infection can penetrate through that open wound in your toe or in your finger. That is why they say use clipper straight across correctly. Before you cut, make sure you are not cutting your skins. The same thing applies to your toes. Do not use razor. Razor, you stand 90% chance of cutting your skin and expose your skin, and that small cut can become a big problem that lead you to amputation, and you know you're diabetic. Now, if you have an elderly parent, the same thing applies to your elderly parent that are diabetics. Do not allow your elderly parent to do their nails, toes by themselves. You do it by yourself. Like that's why I have 2 caregivers. My caregivers does them. My mom allowed them to do that. Okay, and also when you have a caregiver, educate them on how to manage diabetics, responsibilities, how to take care of your mom, and again, how to cut the nails. My mom, the caregiver do all those things to her. They know how to cut it. My mom would never do it by herself because sometimes they might make mistakes at their age and cause injury to themselves. When I go home, I'm a mommy's child. When I go home, I like doing that by myself. I sit my mom, I say, Mom, put your foot here. As soon as, anytime I'm back home, the first thing I look at my mom is her foot. Anytime I fly back home and I meet my mom, the first point of contact, I don't look at her face, I look at her feet to make sure that area is well taken care of. If I feel that something is wrong with her, I will sit down with my mom. I say, Mom, when I was a child, you took care of me. It is me. When my mom, I said, put your foot here, I did everything by myself. Okay, to make sure I take care of her feet. And her feet is always okay. All right, so make sure you cut across correctly without any cutting your skin. Do not use razor. Razors are very dangerous when cutting your toes and nails. So that's one thing. Now let's go to number 7. Protect your feet from extreme temperatures. During warmer weather, use on sunscreens and resist the urge to walk barefoot. So when the temperature is high, like those that are in Africa that experience extreme temperature, do not wear barefoot if you are a diabetic. Also, do not expose your skin to too much heat. Resist the urge to walk barefoot and do not expose. If there's nothing that warrants you to be outside when you're diabetic, do not expose your body to high temperatures. Okay? The same thing applies in the colder weather, in the harmattan period. Do not expose yourself to colder temperatures. Double lace your body, cover your body properly. Okay? Wear socks rather than placing your feet near a heater to stay warm. So these are during the colder weather, you have to lace up. Do not expose your body to colder temperatures if you're diabetics. The same thing during the heat period. If there's not a warranty to be outside, do not expose yourself outside. Stay indoor and then relax. Okay? Anytime you cannot feel temperature changes, there's a problem. You have to notice if you can remember, even if you are not diabetic, anytime there is cold, the first place you start feeling cold is in your feet. If there's cold, if you cannot feel temperature changes around your feet, it means your nerves are getting damaged. Okay, that's a problem. So try to do all those things. Then keep the next one is keep your blood. I think 6, 7, 8. I'm on the number 8. Keep the blood flowing in your feet by keeping them elevated when sitting. I've told you guys, I could remember I did a video, and I'm going to repeat it again. I did a video, and I told you guys, when you are feeling neuropathy, when you are feeling those burning sensations, let's assume, I'm going to go back a little bit. Okay, I'm going to illustrate with my finger. I want you guys to watch. Let's assume this is my feet. This is my feet. Okay. Anytime you are sitting down, do not sit down with your feet straight this way. Or when you are lying on the bed, still do not lie down with your feet down this way. Anytime you are feeling burning sensation or you're having PAD, the way you lie down, the way you place your feet to have an easy blood flow is different. It's all about psychology. The way our body works different. When it comes to your feet, if you want your blood to flow properly, it has to be elevated. Do not, if you go straight this way, you're not going to walk. Your body's supposed to be elevated a little bit this way. Put a pillow at the bottom in your feet and elevate it for easy blood flow. Do not put it straight. You have to elevate your, if you want to have an easy blood flow, elevate your feet, your leg a little bit up. Put something up. That's how blood flows. When your leg is straight, it doesn't flow properly. The same thing when you are sitting down on a couch watching TV, elevate your leg a little bit up. Even when you're having those burning sensations, when you put elevation on your feet, you see that burning sensation subside a little bit. So you have to learn how to position your leg. Elevate, to have an easy blood flow, elevation is important around your feet. If it is straight, there will be no blood flow correctly. So you have to understand how the body works. So this one I'm going to put it there because I'm going to put it out there for you guys to, are you guys there? Are you guys still watching? Because I could see the number has gone down. Okay, I think this is number 6, 7, 8, 9. This is number 9. So keep the blood flowing in your feet. Okay, keep the blood flowing in your feet by keeping them elevated when you are sitting. Okay, don't keep them straight. Wiggle your toes. Okay, wiggle your toes and cycle your feet for a few minutes several times during the day. So anytime you are sitting down, okay, anytime you are sitting down, in your feet, the way blood circulates, when they are straight, blood does not circulate properly. You have to apply elevation, a little bit elevate up. Put something at the heat where your leg, at the joint of your ankle, put something up and elevate it. That's how you have an easy blood flow. The same thing when you are lying down on the bed, elevate your feet a little bit up to have an easy blood flow. When it is straight, it doesn't flow properly. In terms of your leg, that's how blood flows. Okay, so I don't know. I was asking my pediatrician why, because to me, why when I was saying that when your leg is straight, I say no. You just apply a small elevation around your leg for a blood to flow properly. The same thing when you are having a burning sensation. When you have a burning sensation, if you sit down and apply a little bit of an elevation, that burning sensation is going to minimize a little bit. But when it is straight, or when you just sit down and put it down on the floor, you sit down like this, you see that burning sensation increase. But if you put straight up your leg and elevate it, you see that burning sensation is going to minimize a little bit. All right. So keep the blood flowing in your feet by keeping them elevated when you are sitting. Okay. Wiggle your toes and cycle your feet a few minutes several times during the day. So wiggle your feet. Okay. It's like this is your feet. Okay. So you wiggle it, and then your toes. Let's assume this is your toes. Okay. You just exercise your toes like this. You wiggle it. You are only doing your toes, not all your feet. For your feet, you have to do everything about your feet. You up and down. But on your toes, you are now wiggling your toes only, all your toes, you are wiggling them. That's, few minutes, several times a day. Okay. That's how to keep your, feet. Then the next one is staying active. Come on. The next one is staying active with movements such as walking, riding a bicycle, swimming, which are less likely to damage your feet. I told you guys a story yesterday. Okay, walking is very important. People don't think, people say walking is one of the best exercise. Among all the exercise we have, walking is the best exercise for a human being in terms of your heart rate, giving a healthy heart and a blood flow. Walking is one of the best exercise. You could see men that are 80s, 90s, you see them here, you see them walking to nowhere. And you say, what are these old men doing? You see a 90 something years old man in Western world, still strong, walking. But in Africa, you say, well, this man is like he's gone mad. Why is this man walking up and down? They call it gone mad in Africa. But here, they don't play with walking. You see a man, 90 years old, with his wife holding hand. They are walking to nowhere. You don't know the meaning of that walk. That is why they are still healthy at the age of 90-something. But go in Africa and see a man in 70 years old. You see them bending. They can't even walk. They are walking, bending. And when they see you walking, they say, this man has gone mad. Why is he walking nowhere? You see, psychology is brain. Walking is one of the best exercise to give you a healthy, long life. Don't play with walking. Now, I told you guys a story yesterday. Those that watched me yesterday, I took one almond for one day. It did not give me any reaction on my neuropathy. I didn't feel any burning sensation. I said, okay, because I wanted to test something. Because every fruit contains carbohydrate. It depends on the amount that you eat that is going to spark up your sugar level. So the first day I eat one almond, I don't have any reaction on my feet. I was normal. I wait for the second day, I eat two. I didn't have any reaction. It was normal. I just want to gauge at what point that I'm going to have that spike up in sugar level and then start having that burning sensation. Because as soon as your sugar level creeps up, okay, you start having that burning sensation. Then the third day, I eat three, just common 3 almonds. My legs are on fire. I cannot even sit because I was rubbing my feet with my 2 legs. My leg is on fire, timbleness. I say, what have I put myself on? I just changed my wear straight to the gym. I want to get rid of this nonsense. I started on the treadmill. I was running on the treadmill, sweating. I just want to get rid of it because I was rubbing my feet. I said, wow, only 3 almonds. My sugar level just go up. I run on the treadmill, sweating everything. I sweating, run to just get rid of this. It's not like it's going to completely get rid of it, but at least it's going to bring it down to a temperature whereby I can relax with my feet with no problem. So I did just on treadmill. I didn't do any exercise. I was just running on treadmill just to sweat it out. Did whatever I did, came out of the gym, take my shower. At least now the sensation subside to up to 70%, 80%. At least it's not like before that I was rubbing my feet, but at least I can sit down comfortably without twitching. Then for the rest of the day, the thing just calmed down. All of a sudden, it disappeared. Then at least I know that 3 almonds can change my sugar level up. So now I can only eat only 1 or 2 almonds if I choose. That is why this almond has been here for 6 months. I have never touched it. I just leave it there because that experience scared me away. I say, you know what? Almond, goodbye. I don't buy that one has been here since last year. The one I showed you guys yesterday, since last year. I don't touch it anymore because of that experience. At least I know I can't go beyond 2 almonds. Anything 2 is going to spike up my sugar level and then start giving me that burning sensation. So for that scare I have that day, that almond had been sitting there since last year. I don't touch it anymore because I don't want to go through that bad experience anymore. So what am I trying to say about keeping, about staying active with movement, such as walking, riding a bicycle, or swimming? All those exercises is going to aid blood flow in those nerves, keep your nerves healthy and blood vessels healthy. That is why exercise is very important. Okay, if you are exercising, you're going to keep your feet from any deformities, because then it's going to aid you blood flow, because all the arteries and the blood vessels are going to be open. The blood are going to flow normally. Your arteries, your heart is going to be pumping blood regularly because you are healthy. There are going to be any cholesterol issues. You're going to have a healthy cholesterol issue, healthy cholesterol, and then your bad cholesterol are going to diminish because of your physical activities. Exercise is very important, and I've said it several times. Exercise is going to wipe away 50% of your diabetic situations. If you are constantly exercising, it's going to solve about 50% of your diabetic situations. Even if you mix your medication for one day, your sugar level is going to still be stabilized. So that is why exercising is very important. So do not, when you see people walking, don't call them madness. Walking is one of the best exercise that can give you extra life, long to live. You could see men that are 90, 95 years old here, they don't walk with stick. They are walking healthy. You see them walking with their wife, holding hand in the street, walking in the park, just walking. And they go home, take their shower, relax, and they live healthy. But in Africa, when you are crossing 60, 70, you're already bending down. You can't even walk straight because they regard walking as madness in Africa. See a man walk up in the morning, he walk from one street to another. They say this man is like he has something is mad with him. They don't know that he's trying to keep himself healthy. You don't know what sickness is undergoing that he need that exercise. All right. So that is one thing with exercise. Exercise is very important. Staying active is very important. Movement is very important. And that is why I said, if you are working in an office, if you are working in an office in a computer job, if you're a diabetic and your job 9 to 5 is sitting in front of a computer, it's not good for you. As a diabetic, you have to be moving around all the time. Stay in one place as a diabetic wasn't the situation. You must be moving around all the time. So if you are working in a desk that is sitting in front of a computer like this, and then 9 to 5, you have to calculate break period in between times that you have to get up from your desk and take 5 minutes walk or 10 minutes and come back and continue your job. So when you walk, you say, okay, I start my walk 8 in the morning. By 10 o'clock, I have to take 20 minutes break or 10 minutes break and walk around, walk down the staircase or go on the street and come back. You have to inbuild walking around. Do not stay one place. It's going to worsen up your situation as a diabetic. You must be walking around as a diabetic. All right. Beatrice says, how many times can you exercise? Every, it depends on your age and your mobilities. Okay, but at least make sure, like for instance, me, if I'm not busy in a day, in a week, I can do 4 times every day in a week, 4 times in a week. If I'm busy that I cannot finish up in time, I do 3 times in a week. Okay, but personally, me, if I go to the gym, I spend at least minimum 1 hour in the gym, or maximum 2 hours. So depending on your mobility and physical active, like for me, I've been exercising right from when I was a child. So I have get used to it. Okay, right from when I was a child, I play soccer, I play professional soccer. So I have built that exercise in my system that I can go, at my age, I can go 2 hours non-stop in treadmill, running in treadmill, still be active, because it's something you start right from a child. Your body have been used to exercising, running in the field. Okay, so if you are not somebody that have started exercise from a childhood, maybe at your adult age, it is going to be very difficult for you to do 45 minutes. So what I always encourage is, if you are somebody that don't used to exercise, but because of health situation, you want to go to exercise, start with 10 minutes, and then increase 10 minutes for this week, do 10-minute exercise for this week. The next week, do 15 minutes for 1 week. The next minute, increase it gradually until your body, because that 10 minutes, your body doesn't know if this is constant. So that 10 minutes can be, you see some people that do 10 minutes exercise, by the time they go home, they cannot even get up from bed for the next 1 week. They can't even get up from bed. It's like they use hammer and break their joint because their body is not used to those exercises. So that 10 minutes you are doing every day, you are training your body to adjust your muscles. So when your body starts recognizing that, okay, now I could see that so your body is not going to be changing to adapt to exercising. So that first week you do 10 minutes, every day 10 minutes, then the next week increase it to 5 minutes, making it 15 minutes. So gradually your body, your muscles are going to be changing now to understand your routine that, okay, now, so that 10 minutes gradually you are building your heart rate to be adjusting. If you are not used to exercise, do not start from 40 minutes because if your heart is not strong, you can collapse. So gradually start from 10 minutes and adjust your heart rate to keep adjusting. The next week, 15 minutes. Okay, the next week, 20 minutes. That is how you build your gradually, and your body, your muscles, your heart rate is going to be adjusted. That there comes a time you can go for 30 minutes exercise without being tired. So start from 10 minutes every day for the first week. The next week, increase it to 15 minutes exercise every day. The next week, 20 minutes. You gradually, to an extent, you can do 30 minutes exercise 3 times a week. Okay. Now, if you are pumping, if you are opportune, maybe your husband has money, or you are one of those middle class that live in an upstairs, one story upstairs, and then you have a staircase. You know, you have ground floor and up floor. You have a staircase. If you are not used to clamping that staircase, you cannot even clamp it 22 times, and you are tired. That staircase is an exercise. So you can use that staircase and clamp 1. You see, when you start from ground floor, go up and come down is 1. You go back again and come back is 2. So if you see, if you are not used to it, by the time you go 2 times, you are tired. That 2 is okay because your heart rate is going to change. You do two-step clamping. The next day, increase it to 3. The next day, increase it to 4. By the time you do it for a week, 2 weeks, you see there comes a time you can do 10 staircase without being tired. So everything depends on a gradual process until your body changes to understand that now you want to start exercising. All right, so that is how it works. Yeah, exercise can increase blood flow in your body, but not dead feet. Once your nerves are damaged, they are completely damaged, cannot be repaired. A dead nerves cannot be repaired, cannot be recovered. Once your nerves are gone, they are gone finally, it cannot be repaired. You can only save the nerves that have not been dead and give them breath of life. All right, so that is something. So exercises can help you a lot. So let's go to the last one. The last one is get a regular food check that involves physical examinations. Mbia can bear me witness on that. He is a general practitioner, how they check their feet, physical examinations. So you have to do a regular check. You go to a doctor's office, they check your feet, ask you remove your feet, they check, touch your feet, use utensils to hit your nails, check physical examination to make sure there are no open sores or blisters on your wounds, and make sure the veins, they look at the veins and see how the lining of the veins and the blood vessels are seen, because from the veins and the way, because there are some veins you can see from the periphery of the body and see how the lining of your veins are and the blood vessels, and see if there's any deformities in the veins, and see if there's anything they can do to straighten those things so they don't have blood clot on those areas. So these are the things doctors do. So these are things you can do at homes to make sure you are checking your feet, okay, properly. So I'm trying to balance everything from my own expertise and so the things I know from my own expertise and from the things got from pediatrics, I'm joining them together to share with you guys. So these are the things you have to do taking care of your feet at home. They are necessary if you're diabetic. You must check your feet at all times. Okay, you must check your feet at all times at home. We've been here for 3 hours now, so I think I'm going to keep it. I'm going to stop it here, because even me, I'm getting hungry now. I have to go and find something to eat. I still have I still have how to treat diabetic foot. I've not covered that area. How to treat diabetic foot. I've not covered that area. When to see a doctor, a surgery. I've not covered that area. And then how to have a good maintenance of diabetic feet. I've not covered. So I still have about 4 topics on this area that I've not covered. I'm going to stop here because I could see the numbers are going down. Most of you have disappeared. Most of you are not here. Yeah, Mbia, thank you very much. I'm going to send you my WhatsApp number so we keep in touch. And maybe one of these days, let's share ideas in case if you have anything confused, we can share it. But I'm going to look around. Even as I said, I was trying to explain to you I have been trying to get one specialist to join me on my live program. I couldn't get because specialists don't play with their time. You're going to pay them to come to your programs, but we know how sometimes they when they need help from me, I know how to accommodate them. When I need help from them, I know how to accommodate them. So, but I'm going to try to put some word and see if somebody is willing to communicate with you over there and guide you. I'm going to try and see what I can do. Okay, so that we're going to share a number. Since we're a general practitioner, I'm going to see how we're going to talk on WhatsApp. I'm going to give you my WhatsApp number. We communicate on WhatsApp and see what we can collaborate together. I thanks all of you I know what doctors are going through in Africa. I know what doctors are going through in Africa. So I thank you for your service over there. Thank you for your service over there. So these are the topics. I have 4 subheadings that I have not covered here. How to treat diabetic foot, when you need a surgery, and then what are the healing process and maintenance for diabetics. These are the topics remaining to cover here. And then I could see most of you are hungry. Most of you say you are hungry, you want to go. For me to continue, I have to see how many people want me to continue before I know whether to stop here. I have to see how many people that want me to continue. If they are not up to 10, if they are not up to 15, then I'll call it a day. I want to see how many people that want me to continue. So these are diabetic complications. These are diabetic complications. Okay, these are diabetic complications. If you are not taking care of your diabetic situation, these are diabetic complications. All right, as you are seeing there, if you don't control your diabetics, you have what we call diabetic retinopathy. We have Samreta one say I want me to continue. So these are the diabetic complications. If you are not taking care of if you have uncontrolled diabetics for a longer period of time, you have what is called eye disease, diabetic retinopathy. I will discuss that. I have a lot of video on my page about diabetic retinopathy. We've done different kinds of retinopathy, the stages. So there are videos, tons of video for you to watch on my page. Okay, on diabetic retinopathy, how you are going to lose your eyesight as a diabetic if you don't control your sugar level. So that is diabetic retinopathy. And then we'll have stroke. Okay, how do you get stroke? Somebody's going to tell me, why do you get stroke if you're diabetic? Yeah, there's a linkage. If you don't control your diabetes, you might develop cholesterol issues in terms of you're having a LDL, your low density lipoproteins, and then your HDL, which is your high density lipoproteins, and your triglyceride. All those things can cause you to develop strokes. If you have uncontrolled diabetes, it can cause you to have strokes or heart attack or even sudden death. Okay. Now we have heart damage, which is cardiovascular diseases as a result of uncontrolled diabetes, can have you to have heart damages. Now, credit to this, I'm using credit to iStock. I don't know, I can't see the name of the person that have this picture I'm using, but I give you credit for using your picture on my program. So thank you for providing this picture for me. Now, And then we have renal failure. Okay, diabetic. You have a renal failure in there. All those that have to do with your complications of diabetics. And then we have your peripheral neuropathy. We all know about that. Peripheral neuropathy in your feet, nerve damages, your diabetic foot, and then we have arteriolysis. Can also cause you to have due to uncontrolled diabetes. So these are some of the complications of diabetics if you don't control your diabetics properly. It is important at all times control your diabetic situations. It is important you control your diabetic situations at all times. So as I said, diabetics is not even the problem. Diabetics is not even the problem. It's just diabetic is just a one word. But there are all these offshoots that I showed you now. You see, all these are the complications attached to diabetics. So diabetes is just a one word that is covering everything. Now, if you don't control your diabetics, one of these complications is the offshoot from diabetes. So you might have friends that are diabetics. You are diabetics, I'm a diabetic, he's a diabetic. All of a sudden, he lost his eyesight, and you are still having your eyesight. And you ask yourself, why am I still having my eyesight and he has lost it? Because that is a complication that comes because he or she does not take care of his blood sugar for a longer period of time. Now he cannot see, and then you are still seeing. So that is going to send you a warning to start controlling your blood sugar level so that you don't lose your eyesight. Or he might lose his eyesight, and in your own case, you are having problem of high blood pressure. You become hypertensive. So he is having an eyesight problem. You are having a hypertensive problem because of uncontrolled diabetes. So you see, these are the offshoot of diabetics. Diabetics is just the one word, but the main illnesses you are going to be covering is going to be different from all these offshoots. What are the complications that you are suffering from diabetics? Okay, so that is why I keep using the word diabetes itself does not kill, but at the same time it kills. So someone is going to ask, what do I mean by diabetes does not kill? But I say, yeah, diabetes does not kill, but at the same time it kills. Why I say it does not kill is that if you have a control of your diabetes situation, you're not going to die, you're going to live a normal life, have families. But it kills if you fail to control it and obey the rules governing it, then you start having all these complications. And one of these complications can kill you. All right? So that is why I keep sounding the warning. We don't have a cure for diabetes. So when you see somebody want to sell you something that say this, like I told you guys at the beginning of the program, I was watching it in the page. Okay, when I was watching, thank you for Bia. When I was watching yesterday, I was relaxing, going through on the internet in my page, and I saw an advertisement. Diabetes, if it has a cure, buy this tablet, you're gonna cure diabetes. And I was just shaking my head. I was just laughing. It's a white guy. This is not an African guy now. This is a white guy advertising on the Facebook. Oh, this cures diabetics. Just one pill, and that is it. And I was just shaking my head. And I was curious. I went to the page. I was looking at it, and I see people only asking the price. How much is it? This guy is going to make millions out of that tablet. He doesn't care. He doesn't care whether he's going to go to jail for it later on for selling a product that is not that people are going to buy that product because they want a resolution. People are fed up with this diabetes. Diabetes can make you miserable. So people need a quick. So when they hear this thing can cure that, the people are going to buy it. Just imagine he's selling this thing for $1 and about 20 million people buy it. He's going to be rich overnight. He's going to go and buy mansions, cruise on vacation, living life, and you take that thing and be taking, and it doesn't cure. And at the end of the day, it costs you more damages and kill you. But this guy is making millions from that tablet and making you to believe that it cures. There is nothing like cure in diabetes. You can never cure. It's uncurable. Can you send it into remission? It is possible. That is reversal. You can send into remission, but when you send into remission does not mean it has been cured. That is what it's called long-term chronic illnesses. So sending into remission does not mean it has been cured. It is still there. You still have to do those things, the ability to, all those things they ask you not to eat, you still have to do them. It is when you are carried away and stop doing those things, diabetes can creep back in again. And by the time, you might not even notice until you become seriously sick and go to the hospital. Oh, you know what, your sugar level is too high. And he said, no, but I thought That guy told me that it's cured. I took a tablet, it says cured. No, man, you bought something out of curiosity. It cannot be cured. There are presidents of head of states. There are top celebrities, Nollywood and Hollywood celebrities that are singers, top world-class singers, musicians that are diabetics. They have money that they just tell them how much it is. They can afford that tablet to cure that diabetes, so that they can get free, be free. So if those guys can have the money, just mention the price. They will write a check, give them that medication to cure that diabetes, and they are still today. And then somebody from nowhere tell you this can cure diabetics, and you still believe, and they go and buy that, and he becomes rich overnight. So that's why I keep sending those warning. Do not go and spend your money foolishness by somebody out there in the street, in a bus store, in a bus. You know, in Africa, people selling their drugs in the bus. Oh, this tablet, if you drink, it's going to cure kwashiorkor, it's going to cure headache, it's going to cure this, it's going to cure diabetes, it's going to cure this cancer. I see people in Africa selling one tablet, it's going to cure diabetes, it's going to cure cancer, it's going to, and they are selling it. And then you as an educated person, somebody go and buy that tablet because and then you go and drink it. The guy selling wants to be rich. You buy that tablet, you are drinking it. Instead of solving the problem, it's even costing you more problem. Because one thing you have to understand, those tablets being sold on a bus stop, inside a bus, if you know where they produce those things, go to their compound. It's at the back of the yard. They did not measure all those components, those things they measure, they gather together to form a tablet, and they give you. You are drinking. And I told you guys, anything that you take have to go through your kidney, filter through your kidney. So those things you buy in the bus stop, it goes through your kidney. Instead of healing your kidney, it's damaging your kidney. Because you buy a nonsense drug from somebody who is an illiterate that didn't even go to school, selling a product to you that is an educated person that have been to university. You allow somebody that have not been to school selling you a product, say it's going to cure diabetes, cure cancer, cure gonorrhea, cure syphilis. You buy it. Now you are drinking that tablet, and the next thing you fall sick. All of a sudden, you see that your body is swollen. You rush to the hospital, and they check. You say you don't have a kidney. You need a kidney transplant. What happens? Because you've been sold a useless drug on the street that damaged your kidney because you believe on that drug. Because you don't know the component, how it is made. They just mix something, and then start selling it. The person wants to get rich. And then you are in the hospital now battling with your life. Who is going to donate you a kidney? Kidney is not something you get from the street. Because you allow somebody to play on your intelligence and tell you that this thing cures kidney diabetics. You keep taking it, and then you have a kidney problem that you require, or liver damage because of that drug you are taking. You don't know the mixture of that drug. So you guys have to be wiser. Any place you see somebody telling you this cure diabetics, get the police and arrest that person, or get that product, throw it in the garbage, because it's deceiving people. There's no cure in diabetics. Can you send it into remission? Yes. Can you live in a normal life? There's a treatment for it, but that treatment is not to cure it permanently. It's to give you a second chance to live a normal life, but there are rules and regulations you have to stay in order to live a normal life. You have to obey those rules. As soon as you deviate from those rules, you start inviting troubles into your life. All right. So I've said enough about diabetics, and then we'll have my fellow practitioner here, Bia, that can bear me witness that diabetes has no cure. If it has a cure, I can afford it. Show me that medicine, I'll go and buy it and get rid of out of my bag. Okay, so there's no cure. It's all about obeying the rules and regulations about diabetics, and then you live a normal life. So keep believing, keep doing those things you are doing. You are going to live a normal life. But don't allow somebody to fool you by selling you a product that says it's going to cure diabetics when in fact there's no cure for diabetics. All right. So that is it. Where are we now? Because I've deviated from what I was trying to say. I'm going to, you know what we're going to do? The remaining 3 topics, I'm going to make it as a promise. Next time we have a live video, I'm going to cover those topics. How to treat diabetic foot is what is remaining. When to go for surgery, and then how the healing process continue are the 3 topics we are going to cover in the next time. We meet, because okay, so let's leave it here, because for me here I'm also losing energy. I need to, I'm just recovering from my distant virus, so I need to go and find some. So Samrita, I promise you, in the next time I'm going to do a live video. Before we go to the next topic, I'm going to finish up those 3 topics that is remaining. Okay, those 3 topics, I'm going to finish it up, and then to go. So let's stop here. So I'm going to leave. Do you guys have any question before we call it a day? Do we have any question? Because I could see the number of the view is dropping. That's telling me that most people their data is going down. So do we have any question before we call it a day for today? Yeah, Mbia, I'm going to send you my, let me see if I can get your, I'm going to send you my, I'm going to send you my WhatsApp number I'm going to send you my WhatsApp number on your message. I'm going to message you directly on your page, on your message, my WhatsApp number, so we can communicate there. Okay. So I'm going to send you my WhatsApp number. Once I finish this program, I'm going to send you my WhatsApp number. Or what you have to do, Mbia, go to my page, send me a message on my page, so that I will reply. I will send you my WhatsApp number through the message. So send me a message on my page. So as soon as I get off, I will send you my WhatsApp number. I will reply back with my WhatsApp number on your page. All right, so do that. So do you guys have any question? Separata, we'll finish it up next time. Come back. All right, on the 3 topics remaining. Neka, no, Neka has gone because she's a late comer. She comes late and she disappears fast. Neka is gone. So Brian, do you have any question? Grace, do you have any question? Do you have any question? All right, let me thank you guys. Since there's no question, let me thank everybody for being with me today. As I said, next time we're going to finish up the remaining topic. Everything that has a beginning has an ending. So let me allow you guys to go and finish up and prepare for your work for tomorrow, Monday. All right, thanks for those that are watching me on YouTube, other pages. Okay, I see all your comments on those areas. Thank you guys for your comment. Thank you guys for your contributions. Let's keep growing the page. Okay, this is a new page. I just created this page to help people back home that don't know anything about diabetics. Because the last time when I've told you how this page started, it's not something I was willing to do because my hands are full. But when I see many people, why would people in Africa, other third world countries, dying because of diabetics? I say I have to do something to share the knowledge. It shouldn't be so. I haven't seen people here where I'm dying because of diabetics. Where you see somebody die because of diabetics, where I am located. But in Africa, people die every day like far because of diabetics. So that is why I created this page to share knowledge. So I'm doing my part. What I can do, you also have to do your part. And why I say you guys have to do your part is that if you don't help to grow the page, nobody's going to know about this page. The way Facebook works is that when they see people are engaging in the page, contributing, commenting, and then watching the video, Facebook is going to help to push the page to more. There are millions of pages on Facebook. Like my page might be in the lower end. So the only way my page is going to be on the upper end is when they see you guys are contributing by watching the page, watching and contributing. The Facebook is going to say, the robot is going to say, you know what, there is interest in this page. Can we help him push this page to the upper, to be in the forefront, so that people will now know about this page? So I'm only doing my part. You guys have to do your part by engaging in the page, by sharing the page, and also by liking the page. If you don't do that, the robot or the algorithm in the Facebook is not going to push the page to be in the forefront. So that is how it works. So if you guys don't engage, if you guys don't watch the videos more and more, the page is going to be at the bottom part, because there are thousands of pages on Facebook. So the Facebook is going to concentrate their time on the page that is get more engagement. So as I'm doing my time, okay, to spread the knowledge, you guys also have to if you guys want to grow the page, is by engagement, watching the videos more and often, and then sharing the page, liking the page. And the Facebook is going to say, okay, you know what, there's interest in this page. Can we help to push it more forward? Can we bring it up? So you guys have to do your part to bring it up, because that's why sometimes you see, sometimes I will send a message, I won't be able to come on live because I have to concentrate on my practice when I have too much to do in the office. So this is the only way I can help people back home to say there are things you have to do in order to have a second chance to live with diabetics. Okay? Because Africa, I haven't seen a government that created a hospital or a class to say, hey guys, go to this place, they're going to teach you guys about diabetics, what is supposed to, they don't have it. But here, everything is provided. If you need information on diabetes, government provide all those things, educate you, provide you, help you, assist you on what diabetics is all about. In Africa, no, it's on your own. The knowledge is not there, the facilities are not there, they are not equipping the doctors on treating people with diabetics, so you are left on your own to find out the information that you need. So that is why I created this page, to say there are things you're supposed to do, and I'm glad the more you learn, the also more you share the knowledge to your people. So friends, thank you guys for watching this video. Keep watching the video and keep sharing the pages to your friends. Let's grow the page more and more. So I'm going to see you guys sometime this week for the next video. Okay, I'm going to see you guys sometime this week when I'm going to be live. When I'm sure I'm going to be live, I'm going to post to give you guys an update, hint, I'm coming live. So let's meet and then discuss. So once again, thank you guys for watching my video. I'm going to see you guys next time. Stay blessed, and I love you guys. Bye-bye. Bye-bye.